All right, welcome. This is the December 2nd, 2020 meeting of the Board of Directors of the Kern Valley Healthcare District. And we are called to order. All board members are present. First item of the agenda, on our agenda, is approval of the agenda. Tim, did you have some changes?
I did. There were two items, two items that we wanted to add, one of which is it's an agreement with the county for coronavirus relief fund program assistance that's being made available to special districts. In order, if we do have any thoughts of applying for those funds, then we have to have the board approve this by December 9th. So it's tonight, or we have to call another meeting.
That was a separate attachment. We had it today.
Right, there was a separate attachment that Heidi sent out. Scott is familiar with this, so he can certainly address this because he's dealt with it in some other districts. And so that, and then there was also a request for that we have seen, and I'll get into it in my report, just a huge spike in coronavirus testing up here. And so we're asking board approval to go ahead and add two temporary, basically, minimum wage employees to kind of assist us with that. Their hours would be primarily billable to the county funds that are available.
What you're going to apply for is going to pay for that.
Correct.
Yeah. Sorry.
Right. So anyway, but just again, that needs to be added, so we can chat about that a little bit.
Do we need a motion to?
Well, when we get to that later, we're just adding it to the agenda.
So add those as 9 and 10 on the new business.
Okay. Yes.
We need someone to make a motion that these items arose subsequent to the posting of the agenda and require immediate attention. And then we will need a vote where 4/5 of the directors approve adding them to tonight's agenda.
Okay. Yes.
Can I make that motion?
Thank you, Gene.
Second.
Thank you, John. Okay, a roll call vote. Director Blythe,
Yes.
Director Parks,
Yes.
Director Casas,
Yes.
Director Bush,
Yes.
and I'm a yes.
Thank you.
Okay, so we have added those to the agenda. Now we need to approve the agenda, correct?
Correct.
Okay, so I'll entertain a motion to approve the agenda.
I will make a motion to approve the agenda as amended.
Thank you, Charlie.
Second.
Thank you, John. Director Blythe, your vote.
Yes.
Director Bush,
Yes.
Director Parks,
Yes.
Director Casas,
Yes.
and I'm a yes. Okay, our agenda is approved. Charlie,
Yes.
you and I are zooming in. Would you like to lead us in a flag salute tonight?
I would love to.
Thank you.
If you will, if you have a flag in the area where you are, please face it, hand over heart. Follow along with me, not necessarily repeat with me, but follow with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Charlie.
You're welcome.
And Mark, are you with us tonight?
Yes.
There's Mark. Could you please do our invocation?
I have to unmute, so I can certainly do an invocation, absolutely.
Thank you, Mark.
If those who are present wish to, please join me in bowing our heads. Heavenly Father, thank you for this opportunity to get together with the Healthcare District. We ask that you just oversee and guide us in all of our decision-making. Father, we ask your strong presence in all that we do, in all that we say. We ask that you guard, guide, and protect us as healthcare workers, as healthcare devotees, and as people who really want to help this community better serve. And we ask that you deliver us from this COVID-19 pandemic. We just ask this in Jesus' name. Amen.
Amen.
Amen. Thank you, Mark. And Scott, thank you for your guidance on getting the agenda correct. Appreciate that.
No problem.
Okay, our mission statement is on the agenda for you to read. I won't go over it tonight. I'll move on to public comment. And this portion of the meeting is reserved for members of the public to address the board on items that are under our jurisdiction, but not on our agenda. And so I'll turn to the public if there are any members of the public that would like to address the board. I don't see anybody coming forward, so we'll move to the consent agenda. The consent agenda starts on page 1, includes all of page 2, and the top portion of page 3 of the agenda. These items will be not discussed and approved in one motion by the board unless a member of the public or a member of the board would like an item pulled from the consent agenda and discussed in its regular order.
Okay, I would like one pulled and discussed.
What's that, Gene?
The district record policy,
District.
pages 45 through 48 or 49. 45 through 49.
That is pulled from the consent agenda. Thank you. Is there anyone else who would like an item pulled from the consent agenda and discussed? Okay, seeing none, then we will discuss this immediately after approval of the consent agenda.
I'll make a motion to approve the consent agenda excluding district records policy.
Thank you, John.
Second.
Thank you, Barbara. Director Blythe, your vote.
Yes.
Director Casas, your vote.
Yes.
Director Parks.
Yes,
Director Bush.
Yes.
And I'm a yes. So our consent agenda is approved, and we will go to then district records policy, which is page 45 of the agenda packet. I can give a little bit of background on this. And Tim, feel free to jump in or expand on the background I give, but in essence, this was proposed and put together to address the recording of our meetings. And I think the policy itself says it pretty well. What the intent is the board desires to conduct its meetings in public except as otherwise provided by law, and to maintain transparency and public participation in its decision-making process. Creating audio and visual digital recordings of board meetings with specific committee meetings and specific committee meetings, and making these recordings accessible to the public promotes transparency and public participation. So there's just kind of a precursor of what the intent of the additions to the policy are. So Gene, did you want to
yes.
talk more about it? Go ahead.
Ross, you did a heck of a job. I mean, you put a lot of work into it, and with the availability of Zoom and being able to communicate with the public much better, it's awesome. It's part of the policy now. The only issue that I have is the part where Tim can edit it without restrictions, basically. What page is that on? Russ?
46.
46,
I don't think it's quite.
46, number 9.
There it is. Yep.
Okay. And like I said, I know you put a lot of time in. The whole thing is awesome. When we need it, it's wonderful. However, sometimes even Tim and I don't see things the same way.
Really?
Oh, I thought we always got along. That's right.
And so his view of what needs to be pulled in mind could be totally different. So
Agreed.
I think the board should be involved. And I think he should, if it's serious enough, and I don't think there's anything other than something I might have said to him a couple months ago, that we would run into, and I can't imagine us running into it, but he should at least pull the board, poll the board and get an idea.
I concur with Gene. I mean, I really do. I mean, because like I said, when I saw that it was, certainly like I will be happy to do this. It's something I expect that would be extremely rare.
I agree.
And it's more in the event that there's something that gets out there that might create legal damages for the hospital or things of that nature. But to the extent that I'm going to go out and edit, video and those kinds of things, don't really want to get into that. But like I said, I have absolutely no problem whatsoever with the board being involved or a member of the board chair or whatever, that everything's have to be run through and verified. If there's particular questions, there's a way, I guess, we can figure out how to do that. I mean, I certainly understand your points,
Okay. Well, you could,
how we do that's gonna be a question.
A couple ways. One, you could go ahead and do it.
Yeah.
And then whatever you did, bring it up in closed session the next meeting. That way you could do it immediately, and then we could look at it.
Yeah.
We could unedit it, right? I mean,
Don't know.
Well, we would still have its original.
We would have the original content. Yeah, that's true.
so well, I don't know, but at least 2 board members should be involved.
Yes.
So I would say at the discretion of the administrator with board input.
We can do it that way, or we can do it with
Can I go ahead and provide some input here?
Thank you.
So, of course, this falls under the purview of the Public Records Act. And the Public Records Act lists many exceptions to the public disclosure law. But there's one general exception in Government Code 6255 that allows public records to be withheld if the interest in withholding outweighs the public's interest in seeing whatever that public record is, which is kind of what we're trying to encompass here in Section 9. It's a rarely used provision of the Public Records Act because it's a very high legal threshold you have to meet in order to withhold document that is not specifically exempt from disclosure. Legal counsel is usually involved in this process in determining whether or not the record should be withheld. And then you also have this would not be a closed session item. So if this came to the board, you would consider it an open session unless it involved some potential litigation item. If it did, and Tim said, Scott, can we withhold this? I would probably say no. Just because, we don't have the right as a government agency to withhold those types of records. Inappropriate is probably more along the lines of graphic images. Like if someone hacked the Zoom session and put up images, nudity or something like that, where the district did not want it to be part of its official record. But yeah, it would be, I can't really think of a circumstance apart from someone hacking a Zoom session where you would withhold the recording.
So Scott,
yeah.
what about the instance where there was a discussion in a committee of a personnel matter that really shouldn't have been discussed in open session, and it accidentally got recorded?
So generally, anything that is said in open session, you have waived the right to keep it confidential. So that's why the board and the committees need to be very careful about what they discuss when they're in open session, because you have waived whatever right the district would have to confidentiality by disclosing a record or discussing it in open session.
The other option would be that we do this with legal counsel oversight or whatever, board and legal counsel.
Okay, so it would be a high threshold,
Yeah.
Scott, before you would allow him to do something. If it was just normal policy and he didn't want it in there,
Yeah, no, I'm not gonna do
he
that.
couldn't do it.
I'm not gonna do that, right?
No.
This is
Your
just about me. This
discussions
is
are
about
all-
anybody that comes after me. I mean, so.
Your discussions are all public records, even when they don't reflect well on you,
Yep,
right? Because you're a
exactly.
government agency, and that's just part of the deal of being a government agency. The public has the right to know. So withholding under 6255 is a pretty high threshold. And then, of course, we're required to give a written response if we decide to withhold documents. And that response would say, we're withholding this recording or this portion of the recording, and we're withholding it for this reason. And this person made that decision. And if you want to appeal that, you can contact so-and-so. So there's a whole process in the Public Records Act for dealing with this scenario. Now, that's not to say that you shouldn't consult with two directors. I just want you to know that there is a process in the PRA that handles this type of scenario.
Okay.
But the way it's reading here, the way it's written, he can just edit it any way he wants, and nobody knows the difference unless they knew the original recording. So there's got to be a sort of safety net there somewhere. Not that I anticipate that we would need one.
Correct.
Gene, my intent in drafting this was that all of your comments would be stricken from the record, but
I had that coming probably.
Oh, yes, you did.
so if we revise that paragraph to say, at the discretion of the district administrator in consultation with board chair and first vice president and council.
That would be acceptable, but, and it's something that could be changed at the next meeting. So, yeah, but that for a start would be real good.
I'm good with that. I'm good
We
with
can
that.
approve it with that change still too.
Yeah, we could go ahead and prove it with that. Are you comfortable
Yeah,
doing that?
yes.
Okay.
Okay, so then I'll entertain a motion to approve this as amended.
I'll go ahead and make the motion, Mr. Chairman, with the changes to the policy.
I'll
Thank you,
second
Tom.
it.
Thank you, Gene. All right, Director Parks, your vote?
Yes.
Director Blythe?
Yes.
Director Casas?
Oh, she's in the other room. Here she comes.
Okay.
Say yes, Barbara.
Say yes, Barbara.
Director Bush?
Yes.
And I'm a yes. Hey, Barbara, did you, I don't know if you got that discussion. You want to vote on this matter?
This is a matter of modifying the policy so that any editing of the
Yes.
videos would be with input from the from the chair and first vice chair and legal counsel and myself. So that's the way the
Yes.
policy is being amended.
Okay, we'll take you as a yes. Thank you, Barbara. Okay, that policy is approved. Thanks for the discussion. Good points, guys. Okay, that brings us to the report section, item E, and we begin with the foundation report.
Oh,
Debbie?
Sorry.
Gene can do that.
I don't have a whole lot to report from the foundation. We are planning to do the heart walk, but we're also looking to do, maybe if we have to do a virtual heart walk. So, and we're going to be dark for the month of December.
In place.
I was just gonna say, do you walk in place or run in place?
I don't know, we'll figure it out.
Get on a treadmill or something.
Hopefully we'll be able to do it, but we'll see. Any
Is
questions?
this a good time to ask for money?
It depends on what you want.
It's never a good time.
Did you need some money?
No.
The board did approve for any of the CNAs going through our CNA class, if they want reimbursement, that they can apply to us. We haven't heard anything from any of the students, but. they
And
did
we do appreciate that, yeah. There's about 4 left or 5 left, I think,
But,
in that program.
so, that's all I have.
Thanks, Debbie. Okay, that brings us to the auxiliary report.
I've got their reports. Basically, they just indicate not much going on right now. The gift shop is still doing a wonderful job, only being open 2 days a week, and as is the thrift store. They have been very busy getting all their Christmas stuff out and selling it as soon as it hits the floor. They're still planning to have a Christmas party the week of the 12th, or the next week at 12 o'clock. I'm not sure that's going to happen based upon some things that might be coming down from the state in terms of shutting everything down, but we'll see. So anyway, they're saying if anybody, the board or whatever wants to attend, they need to be there by 12 o'clock sharp. And it will be at the VFW behind Taco Bell. So that's their report. And they just wished everybody a Merry Christmas and Happy New Year's to everyone. So
Thanks for passing that on, Tim.
you're welcome.
Okay, medical staff, Dr. Finstead.
All right. Thank you, Ross. The Skilled Nursing Facility Quality Improvement Committee met on November 9th. They reviewed their regular reports, including the CDPH Plan of Correction tracking, Skilled Nursing Facility Quality Statistics, monthly hospital-acquired infection report, hand hygiene compliance, infection control, risk assessment, and the Skilled Nursing Facility Medication Regimen Review. The antibiotic stewardship component of the meeting was held right after the quality improvement part of the meeting, and 2 reports were reviewed. These were antibiotic usages for urinary tract infections on the skilled nursing facility, and also antibiotic usage for wound and respiratory infections. In addition to this, they reviewed 3 of the forms that were currently in use. Our chief head pharmacist, CCON, is planning on concentrating on antibiotic usage for urinary tract infections to make sure that we're doing a good job as far as the antibiotic stewardship is concerned. The whole issue of antibiotic stewardship of appropriate use and not overuse has been going on a long time in the acute care facility. This is a relatively new thing in the skilled nursing facility, but is gaining in, I don't know, momentum and importance and things like that. The Pharmacy and Therapeutics Committee met on November 9th. We discussed COVID-19 preparations along with possibly using the high-dose influenza vaccine for next year's immunizations, particularly for the skilled nursing residents, as they would be a population that could benefit from that quite a bit. We also reviewed and approved 6 policies, including procedural sedation, emergency medications, insulin usage and distribution, comfort care on the skilled nursing facility, and banana bag management by pharmacy. This is related to use in the emergency room primarily, and some issues that have been raised in the past by Board of Pharmacy. The Infection Control Committee met on November 10th and reviewed their regular quarterly and monthly reports, including the monthly hospital-acquired infections for both acute care and the nursing center, the previously mentioned antibiotic usage in the nursing center, and also the infection control risk assessment, both for acute care and the nursing facility. The Bioethics Committee met on November 16 and reviewed and recommended approval of 2 policies, including allocation of limited resources, and then a document regarding the Bioethics Committee. They also discussed trying to add a chaplain, member of the clergy to the makeup of the committee. I believe that there is some a community member who is interested in that. And then the Medical Executive Committee met on November 17th. We reviewed and approved the previous policies from P&T and Bioethics. We also discussed COVID-19 testing using the gold standard of polymerase chain reactions on people coming in from the emergency room to get that in the works as quick as possible, rather than waiting until they come to the acute care to get that specimen collected. And also discussed issues regarding allergy to medications and laboratory culturing issues and things. And that's the end of my report, unless there are any particular questions or anything like that.
Any member of the board have questions for Dr. Finstead?
Yeah, maybe it's just a premature question. With the vaccine for COVID starting to come out into the play, is medical staff in preparations for that in the future, or was that too premature to ask?
Well,
Don, I have part of that report.
Oh,
yeah.
okay.
Yeah, the person you should ask is sitting across the table from you. Tim has more information, I'm sure, regarding that in the county. We did discuss this in the meeting and things, but this is an issue that I'm sure is changing.
Day to day.
What was that about?
It was about the vaccine. Like,
We'll talk about that. I got some information just from 10 minutes ago.
oh, okay.
EUA was approved for Pfizer.
Okay. Well, that's progress.
Okay.
Anyway, that's the end of my report.
Any other questions for Dr. Finstead?
Oh,
All right, thank you, sir.
Oh, you're welcome. More than welcome.
Okay, Tim, it's to you. Chief Executive Officer report.
Got lots of information tonight, so I will try to be as brief as I can on these. But first and foremost, the COVID. Lot of new developments this week on COVID. One of the things, again, obviously we've had an outbreak here in the Valley. Seeing our testing 2 weeks ago, I think we were testing 1 day a week. We saw 131 people come through. Last week, we expanded that to 2 days of testing. We ended up testing 205 people. Today, we tested 263 people.
Oh my gosh.
In 1 day. One day.
That's a record, isn't it?
It's a record, yeah. And we've got more testing tomorrow coming.
By 100.
Yeah, we're 100 over what we normally, the most we've ever done. Yeah.
why are they doing?
Because two things. Okay, one is there's been an outbreak in the community. Primarily some exposures that occurred over in Kernville and a couple of other places.
Are they being hospitalized because of that?
No, we do have one in-house, but had nothing to do with any of that stuff.
Okay.
I mean, it was totally incidental. We have seen a number of patients come through our emergency room for COVID testing. Some have been positive, but none of them have required hospitalization. They've all been sent home. And I think that's really the bulk of what we've been seeing with the positives that have come through, even the community
big
testing.
surge is a $25.
That was the second piece of that was just the volume, and the other was the $25 gift cards that the county decided to make available. And interestingly enough, many of the people that they spoke to today weren't there because of the gift cards. They said, I'd come whether you were offering the money or not. It's nice to have. He said, but that's not why I'm here. As a matter of fact, the county, when they came up today, only brought 200 cards. So we ran out well before we were done.
Okay.
And so the people in line said, I'm staying. I want to get tested.
I told them the same thing. I said, I'm not here for the card.
Yeah.
Well, the other part of that is
the line never left the front of Gene's house. So
Jim, I'd like to make a comment here. There were several people that came from the eastern Kern County area that specifically came for the card. Guys come from Trona, guys came from Ridgecrest. They wasted more gas getting here
It's true.
to get tested than they did to get the card.
And there was one family, I guess, that had 10 people in their car, and they were primarily here for the cards. And of course, we had run out by the time they got
What's the purpose? I mean, why would we give?
I'll share that. It's not us, it's the county.
Okay,
This is the county
okay.
program. It was approved by the Board of Supervisors. They made $300,000 available. So divided by $25 is 12,000 cards they have to give out. So their point was that December 31st, they have to ship all of their available monies back to the state and federal government. And so if they don't use it, it gets sent back. So their point was because of the ongoing rate here, they wanted to continue to get the number of tests up because that has been one of the thresholds for the county. As a matter of fact, I think the county finally met the state's threshold for the first time just this week.
Okay.
And so anyway, it apparently has done that. Now, interestingly enough, we heard that apparently one of the communities, what was it, Mark, that Shannon was telling us, they had 200 cards that went to their community and they only used 62 of them. We had 260 people show up and we only had 200 cards. So and they didn't even plan on sending somebody up tomorrow with cards.
Okay.
So they were going to come next week. And so anyway, I've been on the phone with them several times today. They are in fact sending somebody up tomorrow that will have more cards.
So economically, it's helping the county.
It's helping the county spend the money here in the county. Obviously, it's putting money in families who desperately need it in their pockets, hopefully. Although,
Can you, Tim, touch on the amount of resources it takes to?
Yeah, because this is one of the reasons why I've added one of the bullet items tonight. And this is just the tip of the iceberg here from what else I got to talk about on this. The other issue, again, over there today, we had 4 people from lab, 2 that were out front working on, getting the samples and tagging those and so forth. 2 other people that were actually doing some of the paperwork issues. I had 4 registration people out there, just signing people up, 3 nurses out there. I had to have some of our maintenance guys go out there because of traffic control. And so forth. So it's a lot of effort. And this is just to do the test, let alone the processing that goes on afterwards. I mean, there's a ton of laboratory work that goes on to get those samples ready to be shipped out to the lab company. Okay. And then once the results come back, all of the work that has to be done to notify the people of the results, mail those out to their homes. Some of them have chosen that they want that to be done by email or whatever. So we're obviously, because of all that work, we're going to be talking very seriously. We've had 2 meetings already this week. We've got another one planned for tomorrow to sit down and talk about, we may not maybe give people so many choices as to how to get the information. And so, because they've been calling all the negative results and stuff like that. And like I said, the positives we must call, that's required. But like I said, if there's easier ways to us to, because we had 400 people that we had results that we called this week that we had to send out. And so just from the testing that we've done today, okay, the 262 today, we'll probably get a bunch more tomorrow. The other things that have come down this week is that the state is now, as you know, we've been doing weekly testing on all of our SNF staff. That's been going on for several months. And that's not only the people that work in the SNF, but anybody that goes in and out of there, such as your housekeepers, your facilities people, your radiology or some lab people or whatever. So it's about 80 people that's involved. So first of all, because the county's positivity rate is now over 10%, it now requires us for the SNF to test everybody twice a week.
Is it the rapid test? Is that what it is?
No, it's a PCR. It's a regular
normal test.
Yeah, it's just like that. Yeah. And I'll explain why. Because if I use the antigen test, I have to test them 3 times a week because it's only such a narrow window that it's good for. So that's a nightmare. Okay. On top of that, the Wednesday evening before Thanksgiving, the state health department sent out an all facilities letter to all the hospitals, notifying them that effective by December 7th, which is Monday, we have to have a mitigation plan in place as to how we are going to begin testing all hospital staff, paid and unpaid, for weekly testing. Okay? That's another 160 people that have to get tested every week.
Money in that contract we're signing to pay for all that?
No, it's not even included in that contract. That was community testing. So the SNF stuff we've been paying for. So, we were hoping the possibility of maybe moving some of that into the community testing to have the county. I mean, there's only enough money to go through the end of the month with the county anyway. At this point in time. But because of the increase in the volumes that we're seeing over there, there's no way that we can move that staff in there. So, and just to put it in perspective, we are looking at 160 additional hospital staff This includes HR, business office, administration, everything. Auxiliary has to be tested. Plus 80 times 2 is another 160 for the SNF. So we're talking about 320 tests a week. Okay, that's
Hey, Tim,
at $100 a test that it costs to run the test. It's $30,000 a week that we're gonna have to
That's over
pay.
1,000 tests a month if you add all that up.
1,200. Yep.
hey, Tim,
Yeah.
I did not count the pink ladies in that.
Yeah,
So-
I know you did. So it's a little high, but just at a minimum, you know,
It's
360.
350 now.
Yeah. So anyway, this is huge. And so this was a major conversation on my call tonight with the CEOs in the hospital.
Tim?
Yeah.
Tim, this is Chet. I
Yeah.
just want to make sure when we do have these incremental costs, that I have a way to separate them out.
Yeah.
And the way we're doing it at this point is for them to be charged to the infection control department
Yeah.
rather than their home department.
Yeah. How do we
So,
want that done?
That's
Chet?
important that we make sure that that staff for those times that we're paying for charges their hours, the costs that are associated with their testing
Yeah.
are charged to infection control.
Oh, yeah. Yeah, we're, like I said, we were just chatting with this.
Leave them in their home
Most,
department.
like I said, we at least have the experience of been doing this for a number of months now with our SNF. Most of the other hospitals in Bakersfield have no clue what this is going to entail. As a matter of fact, when we were talking tonight, they had a graphic up of how many employees each of the hospitals had. Memorial has over 2,000 employees.
Oh, I was just gonna say.
Okay, do you know what their costs are gonna look like to do this program? So we have a members-only meeting with the Hospital Association tomorrow afternoon, or tomorrow morning, actually, to go over this with Carmela Coyle, the president. This CHA was at the table with the health department in putting this together, and all indications as of last Tuesday were that they were going to delay this. They were not going to make this happen. Something happened between Tuesday and Wednesday night when this went out after everybody was gone, that now you must test weekly. So everybody's in an uproar statewide because none of us have the resources to do this. I mean, what we had to put together just to do the community testing alone today was monumental feat. And I will hand it to our staff. They did a phenomenal job. I mean, just jumping in and so forth, but I don't have people to do that every day, you know, and so this is going to be a big issue for us. And
Now, what about when the vaccines?
that's a whole other issue on top of that.
I know you talked about it, but then you won't have to do as much.
Well, there is that aspect of it. I mean, technically, if you technically vaccinate people, then you'll have less people that might be getting COVID, and therefore, eventually that will come down. How long it takes to build up that immunity is yet to be seen. And so forth. So, but
Their claim is 94%.
because they're looking for us to be the distributors to the community for vaccine. So what we're doing with the testing will be switched to people getting vaccines and so forth. So,
Carly, you have a comment?
I just wanted to ask if it helps in any way, shape, or form in our community testing if we say the kind of no news is good news, we'll notify you if a positive result comes back. Other than that, I don't know if it expedites.
well, I think there's a reason why the county made it mandatory that you must contact them for a positive result. They did not give us those instructions on negatives. So, you know, we've, you know, trying to be.
Some of those individuals need them.
Some people, again, don't maybe have access to computers or whatever. And so, you know, again, that's why we kind of gave people a choice. Some people want multiple notices, you know, so that we're going to go back and relook at some of that stuff.
Well, we were giving them a choice when we were doing 40 to 50 a week.
Right, exactly. 250 a day or more is that's pressing thing.
That is.
Because now, like I said, next week alone, we're looking at almost 600 people that we're going to have to call back between the 2 days and plus our staff and all that other stuff. So that's a nightmare. It's a lot of phone calls. It's a lot of work behind the scenes that really isn't getting captured by this whole thing. And that's what I tried to alert the other CEOs. This is what you got waiting in front of you. So yeah, there was quite an uproar about that tonight. There was a lot of discussion with regards to vaccines, some new information. I wasn't going to talk about vaccines because Mark was going to chat on that, but I do have some information. The Moderna, or the Pfizer has been approved. Their EUA was approved. They are planning to ship out by, I believe, the 15th of December. They are sending Kern County 5,800 doses, which will go to the hospitals for distribution. Not every hospital is going to get it. We are slated at this point in time to get 110 doses. And like I said,
Will that cover the staff? Or
no, we've got 250 staff. I mean, the priority is to give it to your ICU or ER nurses first, your frontline staff, and caregivers that you can share it with the doctors and things like that. And then, you know, if we have other things left, that we can take it out to other departments and other high-risk patients. Our SNF residents have also been in that high-risk category, but they're part of a federal program that's going to be going on that they are providing that to the SNFs and staff, technically, through one of the retail pharmacies. And we've signed up with Walgreens to do that. So they will actually be bringing staff up here to immunize our residents and the staff associated with that. We don't know how many of the staff they're going to be doing, but that will take some burden off of us to do that for those that want that.
what if they don't want it?
If they don't want it, then we can't force it on them. You know, it's not a mandatory thing from
Can
the
we
state.
fire 'em? No.
No, you can't. I mean, technically,
Okay.
it's you know,
Okay, so they have a choice.
they have a choice, and so. But like I said, you know, obviously, the more people get on it, if it does in fact work, then obviously the less testing we would need to do. But there's just so much. And like I said, and as we discussed, the problem with it is a lot of the healthcare workers are kind of declining it. They said, no, I'm not interested, primarily because they don't know enough about it. Yeah. The vehicle that they're using has been around for quite some time. It's not a new means for delivering the vaccine. It's just, they just don't know, because there was so much press that have come out. And it's been interesting because I've watched in the last 2 days, and now all of a sudden the press is jumping on it and saying, no, this is a good thing. This is really looking great. So it's changing. So I don't know if that's going to change public opinion about getting this or not. You know, we've stressed to the hospital association and to the health department, even the current public health department, you need to put out some information so that people understand what it is, how it's delivered, what are the potential side effects associated with this, you know, how long it's good for, whatever you know, we need to know. And so, because otherwise you're going to get all this stuff and nobody's going to take it, right, and it's going to waste. And so, but anyway, that's kind of the latest on vaccines. Again, their plan is that the hospitals will be the distribution points for the community. At this point in time, I know some pharmacies are trying to stand in line to kind of get in that bandwagon as well. We'll see how that works out. But just so much happening right now. I mean, this is, Heidi can attest and Mark can attest. I mean, this has been consuming us, our time, big time. And so it's been a nightmare. Because it's all coming down so quickly. And I think that's been the big issue. You know, these new regs that, again, you've got to have this up and running, the testing for all your people within 2 weeks, with no idea about the costs or what it's going to take to make that happen. Yeah. The other one we had, which was actually one of our consent agenda items, was the SNF infection preventionist. That was another thing the state just mandated, that all SNFs must have a full-time infection preventionist, when acute hospitals by statute are only required to have a full-time person if you have 200 or more beds. So even though we have a part-time person with Mary Completo, who does a wonderful job, we had to go bring on another full-time person beyond her just to cover SNF. And this was a big issue for the rurals because, again, a lot of them have, 15-bed SNFs or 20-bed SNFs or something, and they're having to go hire a full-time person, and that person doesn't count in ratio for your SNF staffing. It's over and above that. So it's just nuts. So there's no consideration for cost of what this is going to, these unfunded mandates again. And I'm not questioning the rationale behind the safety aspects of it. Not at all. I certainly get it. But how they're rolling this out and choosing to do that is my concern, and a number of other people and how they're doing it.
So I had two quick questions.
Yeah.
I know you got a full report, so I'm sorry.
Yeah, the rest of the stuff will be pretty quick.
Okay. The two quick questions are, you said unfunded mandates. Is there any possibility to, apply for reimbursement after this thing is over? That's number one. And number two is the mitigation plan itself. Does the board have to approve that mitigation plan for the district?
No,
Okay.
no, that's something we have to put together with the state health department
Okay.
as to how we're doing. We have one in place already for the SNF. We're kind of taking some of that because that's worked for us. And
Specifically just for the
for everybody else. Yeah, that's right. Yeah.
Okay.
And how we're going to test everybody else. You said you had a couple more questions?
But that was that and like if we could get reimbursed for all
Yeah,
this
the
cost.
issue, again, and there is potentially some of that. The expectation is, again, and I'll get into that later when we talk about what the county is offering us, this COVID Release Fund assistance for special districts. Their point was that, again, if there's any costs associated to anything we've had to do for COVID, equipment we've had to buy for COVID, extra staffing we've had to bring on for COVID, unemployment insurance coverage costs, for people that we've laid off because of COVID, our portion of that is refundable through some of these programs. The testing that I spoke about here is something that we could apply for reimbursement for. The issue becomes, like with any of this stuff, like we went to with the PPP program and all that other stuff, is like I said, there's an audit that has to be done, and Chet's talked about this a number of times. We have to pay for a special outside audit to be done to verify how the monies were used that we've been given all along here. So anything we do through the county would be subject to that as well. But their point is this is a cost. You guys have gotten all this extra federal money and all this other stuff to cover some of these things.
The
So
new
that's their expectation.
PPP plan they've got in the works for hospitals,
What's that?
the new one that they're working on right now.
Yeah.
The hospital portion of it, are you familiar with it?
I'm not sure if I'm understanding.
I think you're talking about the new stimulus, right?
Oh, yeah. No, there is one. Yeah. And I think that's one of the issues that we've been hearing about. There hasn't been a lot yet released to us yet, but
Okay,
the
but
plan, the plan there is there's still about $600 billion or something like that has not been spent from the previous things. And what they're trying to do is to pull that all back, which is one of the reasons why I think the states and the counties are having to ship it all back to them. And then their plan was to redistribute that back out now that they kind of understand where the need is and where the money needs to go, back out to the states.
But specifically the hospitals, you're
A
right.
big portion of that was to be
Yeah.
towards
Right,
hospitals,
right.
was my understanding, yes. So, but again, there hasn't been anything really that's come out into how much, because again, it's got to be approved by both houses and stuff like that, but.
It's the government. I trust them.
Hey, Tim.
Used to, yeah, good.
Ms. Ross, a question on that infection control position.
Yeah.
Are we required to have an infection control person for the hospital?
Yes.
Okay, so we do have to have both.
Yes, we just, like I said, for the acute portion of the hospital, we did not have to have a full-time person. This is part of Title 22, so it is regulation. And so anyway, like I said, you don't have to have full-time until you have 200 beds. And then, but this one, again, this was originally, like I said, a regulation that came out from CDPH. It was an AFL all facilities letter that we received to make that happen. It was immediately followed up by a legislative solution, which was AB 2644, that mandated that we must do this, and it's now part of law. So, so they hardwired this sucker in about this position, this full-time position.
So can we
just
hire,
remember, if this isn't charged to the SNF, it's charged to infection control.
Where it
That's
goes.
why I don't want it
that's-
in the
yeah.
staffing,
Yeah.
the minimum stuff.
so
Yeah,
can we,
it's not- anyway, so
can we
It
hire?
is it's in the legislation that we do not count it in their staffing numbers.
right.
So it must go to
Correct. You put it in
infection control. Yes.
You don't have a problem from the very beginning, because the
Right.
hours aren't even in the SNF.
Yeah, right. Agreed. Ross, you're gonna add something, or somebody else?
Yeah. So can we use our infection control person full-time in the SNF and then pay her overtime for the work that's needed to be done in the hospital?
Mark's nodding. No.
I think that Mary's been doing way more than part-time work ever since this thing has started.
Yeah.
So we need to find out what the new person in the infection preventionist is going to take on to relieve Mary of some of her responsibility in that light. We
Yeah.
don't know the answer to your question.
Yeah, Mary, like I said, has been doing so much of her work is on the acute side, ER, and elsewhere. Again, she's putting in more than her half time now. And she was covering SNF. So some of this position that's come on will relieve her of some of that, which will certainly allow her to spend more time doing the things she's supposed to be doing, because she was really divided between the two. Yeah, we all wish that. We even went back to the hospital association to see if, because we had a distinct part SNF versus a freestanding SNF, as to whether that would make a difference, because most of us all had infection control people on board already. They said absolutely not. They tried. They said no. This was wired that they had to have another full-time nurse in there doing that.
So can we maybe long-term have this addressed, through the legislation, maybe get Shannon Grove involved and say, look, this is extremely expensive. Yeah, you're not raising your Medicare reimbursement to us. Where's the money going to come from, folks?
Yeah, well, Mark's got I was supposed to have a conference call tomorrow with Mathis regarding 5 issues that are affecting the hospitals. Mark is actually going to be taking the call because I have a meeting downstairs in Bakersfield. So not that I expect that they're going to probably do a whole lot. I think he's trying to better understand what our issues are so we can figure out how to represent us. We can certainly talk to Shannon. Again, right now they have basically no pull, even though they've probably got a little more support than they've had, obviously with some of the pickups that we've had here recently in the Republican side of the House.
Heidi,
Don't know.
would you remind me of that, to add that to my list of things tomorrow to talk to them about?
Maybe
I'm not here tomorrow, so you better write it down yourself.
I don't have a
Just
pen.
I know that Rudy Solis is not our assembly person, but he is a Kern County person, and he's a Democrat, and maybe he'd be a good one to talk to.
We certainly will do that. I know they're talking to everybody. Matter of fact, Vince Fong was on our call tonight with the CEOs, trying to bring him up to speed about what was going on with all the stuff that's coming down. So was taking notes vigorously. I think he was really surprised. It was kind of an eye-opening thing for him. So, but it's him going to do what he can do to help us as well. So, but we'll actually, get everybody involved. I think this is going to have to be a concerted effort because, like I said, we're a small hospital, and obviously we have certain other big hospitals have lots of staff they can pull from that we don't have, but they also got a lot more people that they have to test and stuff like this. So this stuff is all going to hit. But we're going to do everything we can to vigorously oppose this. That's why I said the CHA call tomorrow is really going to be geared towards trying to develop some strategies. And they did indicate that, again, that they were really looking at things. They were trying to focus. They don't want to use cost as an issue in their arguments with the state because that's not going to sit well with anybody. So they're looking at it from a staffing perspective, census. They're looking at supply chain issues, and they're looking at lab capacity. Those are real things that are quality care issues. And so that's where the arguments are being made.
Now, that's for all the hospitals,
All
not
hospitals.
for just a rural,
Correct.
small hospital.
Everybody. Yeah.
So we're different.
We need a collective, hell no, we won't go.
Trying to hurt us worse.
Yeah, absolutely. Oh, no question
The
about it.
others might be able to afford it, but we can't.
Yeah, well, some of the big ones are not doing real well financially either because of all this. That's it. So anyway, that's about what I've got to say there. Unless there's any other questions, I'll certainly stay afterwards for anybody that has any questions or whatever. Or obviously, you can call me anytime. Just a couple of other quick things to get through. I did receive word this week that we finally received conditional reservation for our Tesla battery system with SCE. So that is moving forward. That final incentive amount, and that's the incentive amount there was, the reserved amount was $1.8 million to put that in. That final incentive amount will be established at the incentive claim stage after review of the final project cost breakdown and the affidavit of final systems approach with Tesla. So, but anyway, it's moving forward. We got our spot on the list to be approved for the battery systems and the monies behind that. So that's moving forward. They're really in the design stages. Actually been working with OshPod to figure out how to do the hookups and those kinds of things. And Bob probably has a little bit more information on that if anybody's interested, but that's moving forward. Real quickly, the phone system appears to have been repaired. We have for some time had a bad trunk line in this hospital. Was not frequently I would be the one to get it. I'm trying to make an outside call and I get dead air when I try to dial it and so forth. It turns out that that was actually the problem that we were having with all the community trying to call into the hospital. What was happening is because it was the second line in the call tree, we have like 10 trunk lines. So the first line, if the first line was available, the call would go through, okay, if someone was calling in. If they hit that second line, that's where it was dying, and it would hold up everything behind it because it wouldn't roll to the third line until the second line was answered.
We're going to be on that system much longer.
Well, we are getting off of it. Absolutely. We're moving on. That's been a high priority to get the cable pulls. I think our next phase is actually going to get the business office up. The clinic is up and running. Theirs is running fine. We've got HR is up. I think the pharmacy is up. And then we'll move to the hospital as the last, because that's the biggest piece of this thing. So that is certainly working. And so, yeah, we're just waiting. We still got some equipment we're still waiting to get in to do this here, but that's due to arrive shortly. So anyway, we are moving forward as quickly as
They got
possible.
all that old equipment.
It is, and
they don't care.
They didn't care. They kept telling us. I mean, I was on the line threatening them. I said, "Listen, I said, if one patient gets harmed because of this stuff, I'm coming after you." And they basically just said, you know, well, we've escalated this as high as we can go, and so forth. And they came back, I think, late last week, and just said, "This is not a problem. It's yours." So we paid to have a consultant come up from LA that knows our Nortel systems to check this out, and he spotted it right away. And so, no, here's the problem right here. It's not that our system's working fine. It was in their equipment down the street.
Yeah.
There was a fire in the box there, which we didn't know about. They replaced a card. Come to find out that, which they didn't tell us about, that they ended up having to replace all of the cards in there because apparently some of the others were damaged from heat and gas or whatever. And they wouldn't admit that. Finally, the guy told us about it and stuff like this. But, you know, this is a hospital. You know, this is a huge, huge priority. And so forth. But, you know, we came up with the idea, because I was asking Carrie, who was diligently working on this, you know, can we somehow tie up that phone line? That I said, if I get on the line, I'll just put the damn thing on hold forever, you know, to tie that line up so that it'll jump over that and so forth. And we finally figured out, no, it has to be done outside. So they came in, I think, on a Saturday or something like that, and they did it, or late Friday or something like that, and they got that line tied up. Now, I was told this morning that they actually did fix that line. So, but we've been good all weekend. We've been testing it, you know, vigorously, and we've not had any calls that people could not get through. So I've asked Deb to go ahead and communicate that out to the community through Facebook and whatever else means. So just to get that word out. So that's off our plate now, hopefully for a long time until we get the new system. So the building acquisition is moving forward. Heidi and I were down at Chicago Title today. We signed the documents, delivered the down payment check, the remainder of that. There's still some small amount left for fees and so forth. We have to figure out how those are to be apportioned and so forth. But they basically indicated that closing will probably occur once the check closes, once check is cleared. And so they said if it was B of A or one of the other banks, they could do it in 3 days. But
is it a good check?
It's a good check.
Okay, cool.
With our cash, that's not a problem. The issue is because it's a West America Bank, which is like right next door to the Chicago title. It takes 10 days to clear. So they have no.
Of course.
It's a still figure. So anyway, that's where we're at. But that should hopefully be resolved by next week, I hope. Marketing, again, we've been working on some things. Deb is really stepping up, and working on some of the strategic initiatives. One of the things that the board approved early today was, or was it? No, it's coming up, I guess. It's coming up later. Is we address the issues of how we put out professional quality materials, either in-house or to the public for advertisements and those kinds of things. We have a very low cost solution to that that's very easy to do. I've had a number of demos that we've seen on this thing right now. Very pleased by what I saw. So that will come forward. And so there's just a number of things that are doing that. We started what we call the Behind the Mask program, since everybody's wearing masks recently. This is where we promote our employees and so forth. So we've done a couple of them already. I know Debbie Webb was done, Cody Bulgarelli. We've got a couple of others that are planning. We're trying to get Dr. Lopez in there and some others. And those have gone well. I mean, we've actually seen a number of people from the community that have commended us for, highlighting our staff and getting to know them and so forth. It's basically like a question and answer series with the employee where they just kind of tell a little bit about their background and so forth, and where they work and those kinds of things. So, but it's just a really, really nice touch. And so that again was one of the strategic objectives, to try to just improve communications and transparency with the community and so forth, and let them see the human side of what we do and so forth. And so that is in process. We have a new patient portal going up, I believe, 7th Monday. Is that right, Mark?
Carrie's on there.
Or Carrie, are you on?
I am here.
Yes, that's right.
Yeah, patient portal will be going live.
I didn't know you were on there. I'm sorry.
You did great on the phone thing. I was like, oh, there, he's got it all. The patient portal is planned to go live on the 7th. Yes.
Okay. Do you want to share a little bit about that, since I've been talking a lot?
Sure. You need a break. Yeah, the patient portal is.
It's hard, to be honest with you.
We're actually a pilot site with CPSI for this. We are the only Thrive pilot site, so it was a kind of a big honor to be able to do that with them, as well as being able to kind of have our input in how this thing is functioning and its design and all that. So being a pilot site was just a really good benefit for the hospital. So it will do away with our existing Thrive portal, and we'll be using a company called My Care Corner, which is one of CPSI's most recent acquisitions. So that will be going up on the 7th. There's a lot of new benefits, the messaging, the whole look and feel of it is just a lot more modern. There's an application for iPhone and Android that will kind of give that all at your fingertips. And yeah, pretty much it right now.
Any questions for Carrie?
Carrie, I have a question. I know that Nick McGarrett and I have spoken about, we're going to have a meeting here at my office. I'm not necessarily involved, but regarding this, was there an issue with this portable as far as it relates to access through our Mountain View Healthcare Center? Or
no, there's no issue with it. It uses, Mountain View would need its own portal. Mountain View uses a separate EHR outside of CPSI. They use a EHR called EMDs, and EMDs has its own portal, which we currently do not have.
Yeah,
so this or more in-house, inside the hospital type thing.
Because I thought that part of this whole system was design a portal to where patients can make appointments, arrange appointments, and things. And granted, we generally see more appointment patients with physicians, with primary physicians at the clinic than we do here, or than we do at the hospital campus.
Yeah, Charlie, you're correct. I mean, that is an issue we talked about the other day, because this really affects patients that are seen here in the hospitals. This would affect their ER patients that come in. It'll affect anybody that's here for inpatient,
Right.
or other outpatient services through the hospital. As we talk, this is, there's obviously we really want to bring the clinic onto CPSI's system, and Greg is willing to do that at some point. I think it just has not been quite there yet from a design perspective. I think now that these things start getting up and becoming public, it certainly creates one big argument as to why we shouldn't do that. Just because you're right, I mean, it is, having access to your clinic records and what your doctor said and your lab results and x-rays and those kinds of things is really important to know. I've got several, either between Dignity Health or UCLA or whatever, that I use, and I use them frequently. So they're very, very helpful. But we're going to have to make that decision at some point here to convert them over and get them on.
Well, if you need me to send somebody over to Davis's house to put pressure on him, let me know.
I'll do that. He didn't join us tonight, did he?
I hope not.
Yeah, that's right.
I've got a question that was sort of right there. Dr. Lopez.
Yes.
Since Dr. Montez has left.
Yeah.
She's 3 or 4 weeks out. That's a long time.
Well, some of that is just because of the volume of stuff that's going on in the valley here. So it's not, because actually we've picked up, because right when he left, we brought Cody in, and Cody has picked up a good portion of Dr. Montez's business as well. Some of the others have picked up as well. And as he obviously gets more acclimated, he will be getting more and more patients there as well. So, but some of it's just because of the overall volume has gone up because of flu season and all these other things that are going on. So, because they're all of the providers have noticed that their volumes are up. So
it's not because she's good.
Well, part of it is. I mean, I get a lot of very good feedback on her. So she was a great acquisition for us. So she's been very happy here. So we try to keep that going. A couple of things, just 2 more things that I got that I'll chat about. We have been notified that there is a PSPS alert in place for 93240 for tomorrow. That's basically saying that it may be all or portions of the zip code that could be impacted. I'm reaching out to the Hospital Association because they have some great pull with SCE and with PG&E on trying to get these, because our zip code was supposed to have been not done because there's a hospital in it. So, but this one did target us directly. We're reaching out to see what they can do to maybe help us avert a power shut off in our valley here. So
is it because of the wind?
Yeah, it's because of the wind. Yeah, fire issues and stuff.
The latest I saw, Tim, if I may interject here, it was that I thought the closest it was going to come to us was Tehachapi, Bear Valley Springs, that area. I didn't see where it was where they were planning to directly impact.
You're correct. When you look at the U.S., the National Weather Service thing, the lake area up here is not included in the zone for that wind advisory. But I literally just before the meeting started, I got another thing from SCE just literally 5 minutes before the meeting that we're still in the loop for a possible shutdown. So,
okay, I have an opening for a news person, so if you need a job.
We've got the power thing taken care of anyway, right?
How? No.
What do you mean?
Not yet.
We would be in a world of hurt if we had a power shut off. I mean, the reality is these are east winds.
You want to come closer to the mic? Okay. With your mask, so it's a little hard. I'll put mine on.
The reality is in these east wind conditions, the way they funnel around, they do hit Tehachapi harder and the mountains of the Gorman area. We tend to not get strong winds right here around the lake. And that's why even what they were showing on the news this evening did not include anything around the lake. That doesn't mean that the zip code may not, it could, but the likelihood of us getting winds high enough in an east wind condition are not as high as it would be if you were in Tehachapi or any of the Fraser Park area and those areas.
But our backup is working, right?
It's currently working.
Yes.
but it has limitations on what it will actually run.
Right, that's the problem. We don't have the new generator that covers everything. We still have areas that aren't covered.
So, yeah, we can barely function if we're on emergency power.
But we got it.
It is working.
Okay.
Yes, it was tested. It was tested under full load last Wednesday and worked.
Yeah, the reason I'm asking, the last time we had a little failure, it was a little problem.
Yes.
But we're,
Caused a big problem though.
yeah,
Yes, but that problem has been fixed, and we have had 2 load tests since then, and they've both been fine.
Sleep well tonight, Bob.
I'll try.
I'll be calling them otherwise. And the last item I had is actually an agenda item that we put on for later, so I'm not going to talk about it right now. So that's the end of my report.
Thank you, Tim.
Thanks,
You're
Tim.
welcome.
Okay, we'll move on to Mark, Chief Nursing Officer report.
And that's the end of my report.
Okay,
Thank you, Mark.
Tim covered every point that I had on my sheet, except for the one that says in anticipation of an upcoming surge of COVID-19 patients and the fear of a shortage of nursing staff, I've asked the staffing coordinator, with Tim's permission, I guess, to begin looking at a contract for 2 RNs with at least med-surg experience and some ER experience. I've also asked her to begin working on a schedule of offering our own staff a much needed break should they need it during this time. And the reason for this is they're anticipating a surge in this community by the 24th of December. So what I'm looking at is potentially having a couple of RNs here to be able to absorb some of that stress. The problem is in 2 weeks, if I wait 2 weeks, the potential for me being able to get anybody is probably very, very minimal. So having someone on a 13-week contract makes sense. I can also give my staff a much needed break when we have to call people off and put them on call. And so that's
The
kind
other
of
issue,
the plan.
I was going to say, Mark, the other issue that comes into play here is that if we don't do that and we get the surge that comes through, then I've got to shut down our outpatient services again to pull staff in to help. And so I want to do everything we possibly can to keep our outpatient areas functioning, because that's where the money's being made here. And so that's important to me that we keep that going. So again, if I have to pay for 2 nurses for a while, and hopefully our volume kicks up, to cover that, great,
well, they'll be available.
They'll be available. They'll be here. So, and committed to us.
Well, what about the retired medical people?
We certainly, we're doing everything we can to reach out to people that we know. Obviously, Mark, I shared a letter with Mark from a hospital back in Missouri, which I'll make available to all of you. It's a 25-bed critical access hospital in Missouri, and how they've been impacted by COVID. They're a town of 1,800 people. They serve 6 counties around them. There's no other hospital, and the hospital that they could send to has no capacity either. So, and these people are working around the clock. Mark can fill in the rest. I mean, it's a pretty interesting article.
I've not reached out to retired nurses or physicians or anybody else, only because we haven't seen a surge in our facility yet.
But are you?
I mean, that's an issue that California hasn't approved yet. If one of my former nurses has not renewed her license, let's just take one individual and we'll call on Tish, or she's a retired nurse, and I don't think that she would be willing to come back to work, even in crisis times. We have several people like that who are in the community. I just don't see that happening.
Should you need any public assistance in a call to service, let me know.
Absolutely,
Yeah,
I will do
absolutely.
and maybe they will be compassionate enough, but remember, they're in the high risk category too. So we got to think about that. So second point on my bullet point is
Mark, can I add one little thing to that?
no.
No, okay.
Go ahead.
The county has a whole bunch of people who are either retired and or doing other things, et cetera. And it is called the Kern Medical Reserve. I believe it's called Kern Medical Reserve Corps. And so that is an entity that we can reach out to for additional help.
And they have been doing that through a number of the hospitals in Bakersfield. Obviously, they have been stretched,
Yes.
big time stretched.
Yes.
And so they really don't have much. And if they get it, they might get it for a day or two.
There is that already existing.
Yeah, they talked about that tonight. There's a number of things like that the state indicated that they apparently made a deal for a number of Australian nurses to come over to kind of help augment what they've got available. But, you know, again, a lot of the hospitals, again, some of the hospitals took advantage of it. Memorial did, I think Kern Medical did. They would have like a 3-person team come out and they were there for 3 days and then they went home. You know,
Well, the Australians talked funny, so.
yeah, there was no help
They're
whatsoever.
not licensed here. are
Well,
they?
why isn't COVID happening in Australia?
Ignore that, as long as they had.
Good point.
We're
Very
talking
nice.
about somebody's not licensed if they retired,
They can still practice, yeah, absolutely. That's not the issue, yeah. Yeah.
In every hospital's emergency plan, there is a process for approving them
Right.
to
Okay.
practice.
Right.
We were told yesterday in our meeting that to approach the MOAC if we need assistance and in COVID staffing related issues. And that's what we'll be doing.
Okay.
That's the person to talk to.
Yep.
But locally, I'm a member of the Medical Reserve Corps, and we haven't been active since February.
Right.
So I don't put much stock in it being available.
Correct, right.
Amen. So moving on, if there are no questions or further commentary on that. Census has been up for a few weeks, well, not a few weeks, 7 to 10 days now anyway. We had one COVID positive patient on acute care. I want to stress the fact that this patient is 90 years old, bedridden at home, completely unrelated issue. She was admitted for a fracture of her upper arm for pain management and
Yeah, not too
and
much
care. But because of our vigilant screening that Dr. Gross, Dr. Finstad insisted on, we decided to implement a PCR testing program for all admissions to the hospital. 3 days later, this person's PCR test came back positive. We don't know where she got it, perhaps from her care provider. But the fact is our staff had treated it as if they were COVID related until we got the negative or positive result. So we're in good shape there.
She's not symptomatic or anything either. So I mean, it's.
She was asymptomatic, never had a symptom of this particular disease.
Yeah.
And I had 4 more bullet points here, but they've all been discussed. So I'm not going to belabor the point.
I just want to make a note that we can add Ross to our call list since he just volunteered. Make a note of that and get that for the record.
And Tim gave the rest. Tim did give the rest of my report. So that's it.
If you start calling me, I'm the bottom of the barrel. So, hey, we're in trouble. Okay, Chet, Chief Financial Officer report.
Okay, I would like tonight to talk a little bit about the month of October and what we saw and why I believe there were some points of what we saw. And let me start with statistical values. For those of you that want to follow along in your packet, I'm talking about page 17 of the packet initially. And what I want to do is, I'm going to go back for a little bit of historically and say, when we started this fiscal year in July, we were coming to what was thought maybe was the end of the difficult part of the pandemic period. And we actually saw volumes, especially inpatient volumes in the district, go up dramatically. There was a couple of reasons for that, but the very largest reason was that we actually had decided administratively and clinically that we would sequester or quarantine the patients who might be possible admissions to the skilled nursing facility, as well as some others, and put them into swing beds. So our swing bed population actually went up by 31% over our budget in the month of October, for example. And it was even higher. In some cases, it got towards 100% in the months of July, August, and September, mostly August and September. So, and if you, let me just cite to you what I mean by what the difference was. In the month of July, we actually generated $9.8 million in revenue. In August, it was 10.4. In September, it was 9.5. And in October, it went all the way down to $9 million. So what we had was actually where we had been seeing positives. In the month of October, we began to see negatives because we went, instead of the model that we had used before, where was positive patients going to the ICU and patients who were not known, who were potentials, but were asymptomatic, would go into swing beds. And we've made a color-coded system, and that's what's in our mitigation plan, by the way. And we made a color-coded system in the SNF. So what we did is put them into different areas of the SNF. Now, why is that so different? The reason it's so dramatically different is because most of the patients, yes, were potential SNF patients. And SNF patient, most of our patients in SNF are Medicare primary and Medi-Cal secondary. They're crossover patients. In other words, they can meet the Medi-Cal qualification, and their age and or disability has them meet the Medicare qualification. Well, what we get paid from Medi-Cal when they're using their Medi-Cal, which is when they're in the SNF, is about $280 a day. That's about what our rate is right now. It always trails 2 years. That's the way it works. And it's about $280 a day. If they're using their Medicare, which they would be in a swing bed, the reimbursement goes up to about $1,800 a day. More than 4 times the difference. So actually in the net revenue, example being the net revenue in the month of October was 2.1 million. The net revenue in the month of August was almost 2.6, going towards 2.7 million. Well, that's a pretty fair shake of difference. What it did is it threw us down into the type of category. And in the month of August, we actually made $200,000, bottom line, 1 month. Okay, why? Revenue. Okay, month of September, we made 120,000. Okay, now the month of, this is just up from operations now. For the month of July, it wasn't as good because we didn't have as many people going into that category yet. And so we actually lost 74,000. Month of October, when we changed our system, it went down so dramatically in revenue that we lost $300,000 in the month of October. Expenses, actually, you take the expenses, they weren't dramatically different in those months, a little bit, but not much. I'll give you an example. October was this is direct operations, 2.5 million. September, 2.473, so almost 2.5 million in August when we had our big month, and 2.5 million in July. So the expenses, the direct expenses, did really not contribute to our positive or negatives that much. And just thank goodness that we could generate the revenue. But just to show you how some small portions actually of change, however we decide to do it. And I will tell you the only negative in my mind to the system that we had is the patient only has 100 acute days. This is a Medicare patient, 100 acute days each year covered. And then another 100 days in their lifetime reserve. I guess we never would allow somebody to go into lifetime reserve, but you don't want to use up their days if you don't have to. On the other hand, depending on their acuity, it's wise to use up their days. Okay, let's go on. So in the month of October, we were under budget in our acute days by 24%. In the month of, or excuse me, in our swing beds, we were under budget where we had been doing so well by 31%. Our average daily census in acute was 25% under budget. It was actually 3.0. A year ago, same month, 3.1. Year to date, 4.0. Okay, so you can see how much that went down. Now let's take the swing beds. Swing beds, 2.5. Year ago, same month, no COVID, no special handling, 4.9. So where did the swing patients go? Color-coded area? Not. What was it? Okay. No therapeutics? I can't answer that totally. I'd have to look at the clinical data. Swing beds for the year to date, 26.5% under. Okay. 3.4% went down to 2.5. 2.5 is included. Okay. So very different model. Okay. Let's go down to the long-term care. Long-term care, 47.3 days average. Okay. Now we had to do some changing because we did have a positive patient in there, and we did have to have something of a mitigation plan. But let's check against, they were basically the year before that, same month, 56.3 days average daily census for residents. From 56 to 43, same month of the year, so your peaks and valleys. And on the year to date, we were at 49 and went down to 47. That's continuing. It's pretty much staying static now at 49, but it waxes and wanes. Okay. We talked about I heard the acute care mentioned. It is not up dramatically. Matter of fact, it is the second lowest month right now in the month of November. It has been since the beginning of July. Swing bed, okay? It right now is at the lowest level that it has been since the month of September. And actually in July and August, it was much higher. So the inpatient census is not up. As far as the SNF, the SNF patients, as I said, are staying at 49, and they're not going anywhere. So we're not gaining, for whatever reason, the patients that we actually had a year ago, or the patients that we had a month ago, 2 months ago, 3 months ago. Now let's go down to the outpatient side and look at that for a minute. ER is without question at the lowest level per day in the month of October and in the month of November than I have ever seen it. Why? I can't tell you, but I can tell you there is a big marked difference. We're not seeing a surge. We're seeing a decline in volume. Okay, now let me go down to outpatient referred outpatients. Now these are patients who are gone through our clinic and need a lab or an x-ray or whatever. They've been sent by the doctor, or they've been sent by another doctor in town over to that. Okay, what we have in outpatients an increase. It was 14% over its budget. So the situation there is, and that's mostly because, in my opinion, we are 22% above in our clinic visits, the primary care visits. If you're 22% above budget in your clinic visits, what's going to happen? You're going to get the drop. What comes out of it is the referred outpatients to your ancillaries. Okay, let's go down to the specialty clinics. The specialty clinics in this particular month which is basically the behavioral health for the most part, is 14.6% above its budget. So it's not, we're not having, in the clinic side, we're seeing the patients, we're growing. Yes, we have introduced the mobile clinic, not dramatic increases yet, but consistent growth. We actually introduced changing from a doctor to a PA in the 1st of November, and we still had substantial growth. That's the volume discussion. Let me go to the dollar discussion. Okay. In the month of October, we were $1,272,000 below our budget. You can say, well, your budget was crap. We were also $500,000 below the same month last year. And we had a 7% price increase on top of that. So where is it going? Does it mean we're charging less? No, charging 7% more per unit, okay? Because we went up to 7%. We're seeing the volume. It's eating our lunch, okay? The deductions and allowances based upon our contracts, pretty much the same. 22.4% in the budget, or 74.2, 74.0. So tiny bit higher, not dramatically. Bad debts, actually, we're at 2%, which is right on the budget. And this is 2% of gross revenue, okay? So take that and break it down. Our collectible revenue was $460,000 off of our budget. And it was over $200,000 off of our prior year. And we had a 7% price increase. We're not in good shape there at all. Let's talk about direct expenses. Direct expenses cannot be directly proportional. And some of these are, relatively speaking, overhead related, okay? But instead of matching up or even coming close in our net revenue, we actually were $120,000 over, not under, okay? Excuse me, that's not right. I did $120,000 under in our expenses, but not anywhere close to the $460,000 underage in net revenue. Prior year, okay, so prior year, same month, we were about $200,000 over what it was on that month. Do you have an inflation factor in there? Yes, about 4%, and that's all, okay? So where were we over? We were over, was it in salaries? No, it was not in salaries. Was it in fringe benefits? Oh yeah. We went from $245,000 a year ago to $369,000 in the month of October. So it's nice to give people time off. They hit their benefits, of course. And what happens? What happens is your benefit, because you accrue that based upon what you actually take, your benefits go up dramatically. And that's exactly what happened, okay? Contract labor, actually it was not contract labor in this month. We did 131,000 last year. We did 69,000 in October this year. So not contract labor, okay? But benefits. All right, let's go to physicians' fees. Physicians' fees was $303,000 same month last year, $304,000 in October this year. So about the same, okay? Let's go to purchase services. Another one that is interesting. $94,000 last year, $129,000 this year. Most of the purchase services relate to information systems costs. What we are doing to increase our use of programs that we hadn't had, renewal programs, whether it's for patient accounting, whether it's for medical records, whether it's for simply, I guess you'd say, making it safer for our information system. It's eating our lunch, the way we've been managing that, and just in cost. Supply costs. Supply costs, $323,000 this year, $316,000 last year. I don't consider that to be dramatic. And the majority of that is pharmaceuticals, how we manage our pharmaceuticals. And that's getting better, by the way. Utilities, 38,000 this year, 49,000 last year. Now repairs and maintenance is an interesting one because it has a credit. So evidently we had done some portion either ourselves using same items or outside that we contracted for repairs and maintenance that actually we got a rebate back for. But that's not much money anyway, because it's only $6,875 even last year. The insurance, 87,000 this year, 66,000, or excuse me, 25,000. We got a negative on that. We probably, usually once or twice a year, we get rebates. So last year we probably had a rebate in that, which helped us. All other, 66,000 last year, 70,000 this year, pretty close. Leases and rentals, 19,000 last year, 15,000 this year. Depreciation, I realize that's gone net, not non-cash outlay, 44,000 this year, 40,000 last year. Again, what are the big things that stick out? Purchase services and benefits. That's where we got hurt in that area. Okay, let's go down to the non-operating. 39,000 this year, only 2,000. So we gained a positive. We gained $27,000 from our non-operating. Why did we gain it from our non-operating? Mostly because we got some extra money in from either IGT or Prime. I think it was Prime this particular month. I don't think there was anything that we got from the auxiliary. I don't think there was anything that we got from the foundation. It was simply earning a little bit more, about $12,000 more, at least, in our investment. Okay, so it's from actual earnings there, and also $15,000 more for our supplemental. So $300,000 loss in the month of August, 131,000 versus 131,000 profit October of last year. Where does that leave us for the year to date? It leaves us at 5,100 negative. The budget is 46,000 positive. And the prior year, for the year to date 4 months, $250,000 positive. Okay, so that's operations. Now let's go and take a look a little bit at cash. Cash is still good. It wasn't a terrible cash month. We've been having pretty good cash months all along. We're far enough ahead, and this is just for operations. It does not include reserves, that we were at 322,000 when we started the month in our budget. That was based upon the prior year now. What are we at for this year actual? 1.7 million. Why do we have that much in there? Because we've gotten supplemental income for the most part. But in addition, we've had some pretty good months. We've had some, and it's not great in collections because we're still running 86 days. I look at that today. Look at it every day. So it's not the collections. It's actually mostly supplemental money. Matter of fact, if you go to the miscellaneous cash, we were about $58,000 over. You know, and then in let's see, Medi-Cal is insurance is the other thing. We had a good month in insurance. We were $196,000 over our budget in collections. You go down to the cash disbursements and how they came out. For the labor, again, mostly from benefits, we were $362,000 over in disbursements. Because of course, with the benefits, you pay those fairly quickly. Salaries too.
We had 3 payrolls that month too, so that impacted the cash for salaries.
Excuse me, I can't understand.
We had 3 payrolls in that month, which impacted the cash.
I couldn't understand.
Salaries.
We are that far over anyway in our benefits. You're going down from there. We actually had no money that we dispersed for non-operating, and I said we were going to disperse 55,000. So the cash actually net, I said we were going to actually have 175,000 for the operating accounts under. We actually had 1.3 million that we ended up over. Not as high as it would be, and we actually took $500,000 off of what we had been, got it up to, at the beginning of the month. Our operating reserves are right on what I said. The Medicare overpayment is a little higher, $1,074,000 versus $773. So where I said we would end up for operations for the month, $743, we ended up at $2.5 million. That's what's actually happened. It's not a guess. It's not an estimate. It's reality. These things match with the bank statement. So say what you want, but if you don't match with your bank statement, you're not going to do well. And that's my report.
Man, I just, I assume, Chet, that with the excessive increase in benefits overages, isn't that kind of like the stock market where it's going to level out and we're kind of on this thing? Doesn't it eventually correct itself?
It could, Charlie. It could level out. But so far in the year to date, let me just look, double check on the year to date. And I'll
Sorry,
get
guys.
the benefits on the year to date. This is year to date now. This is 4 months. Okay. 1,185,000 this year for 4 months.
Right.
993 last year for 4 months. So if it's going to level out, it's sure not doing it yet.
All right.
Okay. It could, but I wouldn't guarantee that at all.
All right.
Any other questions? Comments? Okay. Thank you, Chet, for that report.
We get that in finance committee next month.
Okay, we've got no old business for item F, so we're to item G, new business. And Gary, are you still attending that baseball game?
You're muted, Gary.
Harry or Gary? Are you talking to me?
Gary, you're next.
Sorry about that. It's a 7th inning stretch here at the ball game, so I've got some time.
Yeah.
Great.
We understand.
I'm glad you're able to balance this and attend that baseball game. It's probably in Hawaii, right? Because it's still light.
It can't be winter because there's no snow on the mountains if you're in Utah.
Okay, so we're at resolution 20-06, authorizing issuance of revenue bonds. And this requires an action by the board, and I'll turn it over to Tim.
Yeah, as you're aware, obviously, we have been working with Gary and with Quentin Themig to take a look at an opportunity to restructure some of the debt, pay down the remaining portion of our bond, to pay off the notes payable to Cal Mortgage that are carryover part of the restructure we did some years ago, and also to provide an additional $5.5 million of cash availability, or up to $5.5 million of cash that we can use towards our building upgrade project and so forth. And so again, we've been working through that process. The board engaged Gary as well as Quentin Themig to go ahead and begin doing the preliminary work to explore that potential for getting this out as a public or private offering and so forth. And so these are some resolutions, a resolution and an ordinance that needs to be approved tonight. So Gary, I'm going to allow you to kind of speak to the details of that and what this is, or answer any of the board's questions.
Tim, thank you. I'll try and be brief here, but as Tim indicated, these two actions are required by the California Health and Safety Code for healthcare districts in the state of California. Both actions are preliminary in nature and will require future board approval in either January and or February of 2021 to move forward with the financing. Resolution number 20-06 is a resolution that provides, again, preliminary authority, as Tim indicated, to refund the outstanding 2003 revenue bonds, to refinance a loan with Oshpod through the Heathcliff Fund, and to finance, again, up to $5.5 million of capital expenditures. Those capital expenditures are expected to include the building and improvements to the building that Tim discussed earlier tonight, the purchase of an emergency generator, architectural and engineering fees associated with the project with respect to the hospital expansion and renovation, the canopy project, and a portion of the administration wing, admitting, and pharmacy project. It also can include some capital expenditures for the district through 2023. Again, as mentioned, the amount of that new money portion is not to exceed $5.5 million. Total amount of the bonds, as indicated in section 3 of this resolution, is not to exceed $12.5 million. So that includes refinancing the 2003 bonds, refinancing of the Oshpod loan, the new money not to exceed $5.5 million, and cost of issuance associated with that financing. It indicates in section 4 that the interest rate is not to exceed 12%. Don't be alarmed by that. That's just the state maximum amount of interest that can be charged. We expect that the interest rate on this loan will be somewhere between probably 2.75% and 3%. And that would be fixed rate for about 12 years is right now what we're expecting. The current interest rate on your bonds that are outstanding in the Heathcliff loan is about 5%. So we're looking at providing a significant reduction in the interest costs associated with those loans and of course with the new money. As indicated in section 5, these are intended to be revenue bonds, repayable from revenues of the district, not general obligation bonds repaid from tax revenues of the district. And it does authorize under section 6 for the secretary of the board to cause the resolution to be published pursuant to, again, the health and safety code. The actual publication would be done by the law firm of Quinton Timmig, who is bond counsel on the issue. And that's really it with respect to the resolution. And I'll entertain any questions with respect to the resolution. And then it's your pleasure as to whether you want to take action on that and then go to the ordinance or have me cover the ordinance as you wish.
Yeah, I'd like to do just the one item at a time. So let's stick just to the resolution for now.
Great. Any questions then on the resolution for me?
Okay, so we're not committing to have to do it.
Nope.
Okay.
Not at all. This is just preliminary in nature. We would come back to the board in January or February for final approval. At that point in time, you would be committing to it. But no, this is not. This is just a preliminary step.
Okay, because it's something we've got to look at because we won't be able to borrow any more money. Basically, it's going to cripple us to the availability of getting additional money. It's going to be a hardship on it just to pay what we got. We're going to need about 15 million more to finish the project. I know it's between 5 and 7 million, but things always get out of hand with the extras, with whatever's happening and the extra architect fees and everything. We'll be looking at probably 15 million. So we're going to have to figure out where we're going to get the funds to do that with. So the new board, we're not doing anything now that the new board can't change and can't look at. So with that, you know, I don't have a problem with going forward. The interest rate's awesome. It's a good deal, but we can't jump into something we can't jump out of, or we can't manage as we go along. So, but right now, first step looks good. I'll make a motion that we go along with that.
I
what we're doing
second.
here. Okay, we got
Okay, we have a motion to approve the resolution and a second. Is there any public comment on this matter? Okay, seeing none, do the board members have any other comments or questions? Okay, seeing none, then we'll vote. We'll start with Director Blythe.
Yes.
Director Parks.
Yes.
Director Casas.
Yes.
Director Bush.
Yes.
And Elliott is a yes. Okay, then we'll move on to ordinance 20-01. Ordinance approving a formal agreement for the sale of Kern Valley Healthcare District Revenue Bonds, Series 2021. Tim, Gary?
Oh, this is a follow-up to the other, so.
It is. This ordinance number 20-01 is like the resolution 20-06, again required by the California Health and Safety Code. for healthcare districts. It's a preliminary ordinance. Again, it sets forth the same information as the resolution did. It does indicate that this will be sold by private sale, as Tim, I think, mentioned earlier. It approves in form, just in form, a bond purchase agreement or the formal agreement between the district and the purchaser to sell the bonds. But again, that same agreement will come before the district board in final form, again, in either January or February, if you elect to move forward at that point in time. This does have a 30-day referendum period, and it's and so this effective date of this ordinance is not until 30 days after the date of its adoption tonight, if in fact the board approves it and adopts it. Any questions with respect to ordinance number 20-01?
Thank you, Gary. Okay, does any member of the public wish to be heard on this matter? Fred?
Ross, on this document, it shows 12.5 billion in bond, not 12.5 million.
That was actually caught before, and I think we put the wrong copy back in here because that was.
Yeah, we do have an extra zero in there. Yeah.
3 zeros.
Three
Yeah.
extra zeros.
A few extra zeros. Yeah.
2 extra.
Then we don't have to worry about that 15 million.
Might be a little bit more available cash. That's right.
Good catch, Fred. Yeah.
Director-elect Clark, that was very good. Thank you.
Welcome.
Okay, so with that correction then, do we have a motion and a second for approving this ordinance?
I'll make a motion to approve the ordinance 20-01 with the correction on the total amount.
Director
I'll second.
makes the motion and Director Blythe seconds. Any other discussion among the board?
It's just that it's a preliminary, it's not,
Yes.
No authorizations
Okay.
until February, January, February.
yes.
Okay, John, your vote?
Yes, yes.
Jean?
Yes,
Barbara?
Yes.
Charlie?
Yes.
And I'm a yes. Thank you, Gary and Tim. Okay, go enjoy your baseball game now, Gary.
Thank you very much.
And
Appreciate it.
just for the record, Gary, I'm more of a Washington State Cougar guy.
Well, they're both Cougars. Thanks a bunch.
All right.
Thank you
Thanks,
for
Gary.
hanging in there. Appreciate your patience with us.
You're welcome.
Okay, that brings us to item 3, Resolution 20-07, authorizing renewal of the line of credit. And Chet, I have you down for this one to discuss.
Yeah, let me kind of give some history. I'll try not to be too long with it. When I came back in the year 2000 to the district as a consultant, they had been having problems in the couple of years before that, especially the latest 12 months, making payroll. It was a difficult situation. In certain times during that year, employees and managers didn't know if they were going to be able to cash their checks. If I say anything wrong, Heidi, I wasn't here yet, so you correct me. So the situation was that there was a petition toward the bank, basically to loan some money for operations, a line of credit. Okay, but the bank would not agree to do so without a guarantee from the underwriter, which was Cal Mortgage, for this particular situation, because they were underwriting the revenue bonds. Okay, so what happened was they actually agreed to underwrite or have a line of credit of $2 million. Now, supposedly, initially, that was going to be for operating expenses that they couldn't meet elsewhere, like salaries. And the first year that we had that, we actually borrowed from it over $1 million. to keep our operations going. So that really carried forward. There wasn't too much that came out the second year, and then we had to renew it. And because we were doing better for operations in that second year, but we weren't able to do much with capital expenditures except what the auxiliary and the foundation were giving to us. So I said, well, can we do this, or can we change? Can we have $1 million for operations? I think we owed over 700,000 at that time. And can we have $1 million for capital expenditures? And they agreed. Okay, so we have it underwritten for that. Fast forward, okay, 2 years later, the situation was that we didn't have to have any for operations. We didn't have to have any for capital expenditures, other than what we were basically being given as a grant from the Auxiliary Foundation. But we still owed.
He froze.
Almost $1 million from the initial year that we had that. Ask for it again. 2 more years down the line, okay? Ask for it again. What they said was, well, you really haven't spent anything on capital expenditures. You really haven't spent anything on operations. You just have a fairly large balance, okay? So the underwriter, Cal Mortgage, said, here's the situation. We want you to, we'll do a line of credit for you, okay? And this is the first year also that IGT came in intergovernmental transfers. They weren't quite as big the first year. I think it was a little over $2 million. And I explained it, and I said, well, you know, we do have this one situation, or this supplemental income situation, where we have to put up front the state portion. And we have to pay the state 20% for going out and doing the collection of the federal portion of these. So I have to send them 2 point whatever million. And that first year, I did take out of the line of credit which they approved, okay? They approved the drawings. They said was
fill in the blank.
The line of credit.
Yeah.
And I got the bank to agree. Yeah, I got the bank to agree to go to $5 million. So we had a $5 million line of credit strictly for supplemental matching money. That is that now. Fast forward again. This is actually 2 years later, and we are now down to about 500,000 balance. And they again agreed to do the $5 million line of credit, but only for IGT reimbursement, or matching, I should say. All right, now we're here. We're here, and where are we? The bank actually, this last year said, we want credit for this, not just every 2 years. We want credit for this every year. And so what we'd like to do, and this was at the end of our fiscal year in 20, we would like to carry this forward, and we would like to agree actually to do it the $5 million if we can get Calvin. I said, will you allow us to do it without the underwriting? No, we won't. So the situation is where we are today, okay? What we, in anticipation of this and also the refinancing, I paid the line of credit down because we got good cash this last year from supplemental income. It's only $50,000. And I purposely, and with Cal Mortgage's support, the underwriter support, I left $50,000 in there because I knew we were heading for annual renewal. This is the annual renewal. Now, it has to be renewed if we're going to renew it by the end of December. I will get there in 1 second, Charlie.
Okay.
And what happened actually was, I was contacted by Cal Mortgage a couple of times. We were contacted at about the middle of November, both the bank and us. I mean, where's your renewal on the line of credit? And I had been dragging my feet because I thought maybe we would be doing something on the refinancing, but I didn't have a final answer and the board hadn't approved it. So where we are today, the paperwork is ready to get done. To do it, the bank needs a resolution. They're ready to agree to the $5 million. Cal Mortgage is ready to underwrite the $5 million and guarantee it only for matching, okay? I could say, no, we'll pay that off. And we won't take any more line of credit for matching. Now, it depends on what becomes terms in the refinancing. And can we, if we're putting all this money that we're 5.5 million into these capital expenditures that we're talking about, that Gary just talked about, can we then, and it's now up to about $4 million is what it was last year. As you know, we went from 4 million to 9 million in reserves, okay? So about $4 million we have to come up with out of our pocket or out of our reserves, if you will, and not get it from the bank. And what we have to decide, and I can tell you what my recommendation is going to be, we have to decide, shouldn't we be, if Cal Mortgage is willing to do it and the bank's willing to do it, shouldn't we go ahead and renew this line of credit? There's nothing left in about 50,000, not a big deal. But if we come to a point that we cannot, or that I cannot out of reserve, use from the 5.5 million, we're going to borrow. That's a no-no. Okay, it can only, that has to be used for the refinancing portion, which, and basically the construction, okay, that project, and capital expenditures. Right now, I started because it's 60 days before, 60 days after the board did a resolution at last month's board meeting. And it's 60 days before that, and then 2 years after that, okay? So for the 60 days before that, I already have the down payment, 150,000.
Hey, Chet, this is Tim.
Yes.
We're starting to lose your signal and stuff like that. Can we kind of just get to the end here? I appreciate the education you're trying to do, because we got the new board members and stuff like that, but you're freezing and stuff like that, and we're losing a lot of what you're saying.
Your audio's dropping out.
It's all right with me if they, whatever, I can shorten it as much as the board wants me to, but they need to understand.
What's your recommendation?
Right.
What?
What is your recommendation? Do we go with it?
My recommendation is to have it as a backup, to go in and we can get it done.
Okay, I make a motion that we accept this.
Because then I know I have the money. Let's say the bonds don't sell for a minute. Let's say they see our loss in October.
That's good, Jet. That's good, Jet. Hold on, Jet.
Don't talk after the sale.
We got a motion.
Okay.
After the close.
Barbara seconded it.
Barbara, you're second. Okay. Is there any member of the public that wants to be heard on this item? Any member of the board that wants to discuss this further? Okay, I actually have one question. If we, we're in the process of refinancing our loan that involves Cal Mortgage, are they going to continue to underwrite us even though we repay that original loan?
If I leave a balance owing on the line of credit, then they will underwrite it. Now, will they underwrite it for 5 million? That's what the bank's trying to get them to do. And I'm certainly not going to say no to that. But they actually told me, and we were going to do the refinancing before, and then for just the amount that was outstanding, because there was still going to be a $6.1 million amount owed to them, that they would underwrite the 5 million. As long as I have a balance in there, I feel comfortable they will underwrite it for something. Exactly how much? I don't know yet. That's the bank and them and us to discuss.
So you have that conversation before we actually withdraw money from this line of credit, correct?
Right.
Okay. All right. And Tim, you're okay with this?
Yes, I am.
All right. And we'll go to vote. Director Blythe,
Yes.
Director Parks,
Yes.
Director Casas,
Yes.
Director Bush.
Yes.
Okay, and I'm a yes. Okay, capital expenditure request repaving of parking area. Page 73.
I'm going to ask Bob Easterday to address this.
Yes, so as you've all seen, our front parking lot is a bit of a mess, having had to do with, repairing the leach field. So what this repair is to do is the area, how there's the cars are in the middle, they face each other in the middle of the lot. It's going from the middle of where those two cars come together in the middle of the lot out to the street, from the first driveway east of the corner up and over to the treatment plant. So it's doing a little more than just what is torn up, but what it does is it does half of the parking lot. Then when we are going to add the new leach field in the south section of the parking lot, we will pick up that portion of repaving as part of that project, so that that whole end of that parking lot at that point will be in new condition. So this is just to repair the north half of the west end of the front parking lot.
Can I make a motion that we accept the proposal to repave the parking lot?
Yeah, I'll second.
There's two proposals in here, and the recommendation is what? The current asphalt one?
The current asphalt is the one we want.
Yes, yeah, it's substantially less than the on-stock proposal.
If I remember correctly, Bob, you were talking about a 2-inch as opposed to a 1.5 inch or something along those lines.
It was one was 2.5 and the other one was 3. It's really a minimal difference.
Yeah.
It's car traffic only, and car traffic is handled very well with 2.5 inch. I don't think there's a need to go thicker.
Well, until I get my new Humvee, we'll be okay.
Yeah. All right.
I know that our buses park in there. Is that going to affect?
Not that much.
Mostly.
Charlie, you need a Humvee.
Yeah, no. They will handle the weight of those. I'm referring more to like dump trucks full of dirt that weigh like 4 times what our bus weighs.
Delivery trucks, yeah.
Okay.
Semis that they deliver on the backside of the hospital.
Thank you. Okay, Gene, so that was a motion to approve current asphalt.
Current asphalt, yes.
Do we have a second?
Yeah, I second it.
John, thank you. Any member of the public wishing to be heard on this item?
Yeah, let me just say that the contract that is in the board package is not the contract that we will use. This is a public works project, so we will use the standard public works contract.
This is just the bids, right? Yeah.
Okay.
Thank you, Scott. Okay, any other discussion by members of the board? All right, Director Blythe, your vote.
Yes.
Director Parks,
Yes.
Director Casas,
Yes.
Director Bush.
I'm always last. Yes.
I'm a yes. Thank you for your levity.
I'm gonna go first on the next one. That's right.
Okay, item 5, Healthcare Marketing Center.com service agreement. Tim?
Yeah, and as I shared earlier, again, we've been working on a number of the strategic initiatives. Obviously, one of the ones that was put forth was obviously from our ability to put out more professional pieces representing the district and what we do, communicating both internally and externally to the hospital. Deb Hess and her team have been working on a solution to that. I'm going to let her chat about this. So Deb, do you want to talk about it?
No, I was getting out of it.
No.
So what this is, think of it as a library. What I do now, if I do brochures, I have to depend on the department managers for the information, and I go and I look through the internet for different information and put it together. Or if we're sending out, say for the month of February, it's heart Heart Month, I go on the internet and I could spend hours and on the internet looking at different things, and I have to make sure that it's not copyright fringe and a bunch of stuff. So this is an online library of items that we would subscribe to that's ready to go. And all I have to do is put in our logo. I can change pictures to local pictures, and it'll save tons of time cruising the internet. And it also is going to give us a much more professional look, which is something that came out of the strategic planning.
And the cost on this?
Oh, I'm sorry. The cost is, if I remember, it's $300 a month, and this is a year contract for us to try it out.
I'll make a motion if I can that we accept her proposal.
Thank you, Gene.
I'll second.
Thank you, John. Okay, any member of the public wishing to be heard on this matter? All right, seeing none. I do have a question. If other board members do too, please chime in. Scott, on the contract, in the indemnification and limitations of liability, there's wording in there that gives me pause, and I just wanted to make sure I understand what it's saying. That first paragraph, well, I guess it's one paragraph, it's all one paragraph, but the first run-on sentence basically says that we're going to indemnify the software company if we use one of their pictures or images and that picture ends up being, there's a claim by a third party that picture shouldn't have been used. It was owned by somebody else. Am I reading that right? Are we on the hook for verifying whether their materials are safe to use?
So that is what it says. Yep. Yep. The second sentence kind of cuts against that and gives the district a remedy against the company if they have violated a third party's right. So you can read those as being contradictory. But yes, that is correct.
So we have access to Getty images through this. So if we use anything, I think I would use the Getty images, but a lot of our intent is try to put our own photos in there.
Yeah. I mean, we can use the stuff. Scott, I would ask that because this company operates under state of Georgia rules and regulations and laws, do you foresee any conflict with state of California?
Yeah, so Tim and I talked about this a little bit, and of course, you guys use a lot of vendors who are out of state,
yes,
especially with the tech you use. And so with each contract, what we look to weigh are the risks and costs that would be associated with the contract, because this is the risk here was assessed to be de minimis, and the uses for the product that they provide are limited in scope, meaning you're promoting the district within your community. This is not a statewide project or a regional project, and so we chose not to fight that battle. With contracts where there's more exposure, there's a higher risk factor, that is often one of the clauses that we fight over. But with this one, Tim and I discussed it, and we concluded that the risk was de minimis, and so we weren't going to fight them over the choice of forum or the governing law clause.
Okay. That's what I needed to hear. Thank you. Okay, so we have a motion and a second. Is there any other discussion among the board?
Oh, I'm sorry. Can I say one more thing?
Yeah.
Ross, you raised the question about the limitation of liability paragraph. And you'll note that the last sentence says that a party's maximum liability shall in no case exceed the total of monthly service fees paid by customer. And originally that was just their liability would not exceed that amount. But we went back and changed it to make that mutual, and they agreed to it. And so they changed it so that that is a mutual limitation of liability provision. That is something that we will take back to them and say, no, we need to change this. So they were amenable to that. They made that change, and so we're happy with that.
Okay. Yeah. Thank you. Okay, then to the vote. Director Bush.
Well done, Director. Yes.
Director Casas.
Yes.
Director Parks.
Yes.
Director Blythe.
Yes.
And I'm a yes.
Great, thank you.
Okay. Barbara, let us know how that works. And we hope to see great things coming out of your shop with
Barbara or
getting
Deb?
images.
Barbara or Deb?
I think he's tired.
What did he say?
He said Barbara, let him know how that works.
Yeah.
I'm Barbara. I'm Debbie. Sorry.
Sure.
I'm looking right at Barbara and thinking of you, Debbie. Okay, item 6, the PAX system upgrade, change in vendor. Mr. Zuber.
Yeah, this is more of a, like it's informational, but Carrie, please proceed.
Hi, good evening. So, yeah, this is exactly what it sounds like. I mean, just a change in vendor from what we had originally planned. We had originally planned to go with a company called Nucleus. We got, I would say, 70% done with the project, and then we're informed that they had been, well, we were informed early on that they were being purchased by another company, but at the time we're told that it wasn't going to come into play with what we were doing. But towards the end of the project, it absolutely did. There were several services that they were unable to provide us. And ultimately we had to get out of the contract and kind of just abandon them as a vendor.
Hey, Carrie?
Yes.
I'm sorry to interrupt you. Just have a basic, stupid question. What is PAC? What is the system?
This is radiology's system.
Picture archiving system for your X-ray images and so forth and CT scans. It's electronic storage.
Thank you.
And reporting.
Yeah. I was going to have to look up what PAC stood for. I was about to Google an acronym. I don't know off the top of my head what it means. Anyway, so yeah, so we had to change vendors because of those reasons. And so it left us scrambling, trying to find out kind of who we were going to use. And ultimately I decided that the best company to use was our current vendor, which is ERAD. And so we will just be migrating to new servers with them, which will solve the big problem why we were getting a new PAX in the first place was our storage capacity. Is where our storage is reaching its capacity and our existing hardware is about 7 years old. So it's just time for an upgrade. So this will satisfy that. It actually ends up coming in close to $1,000 cheaper than the original proposal I made to the board. But this will be an on-premise solution rather than a cloud-based solution. So just to let you know that the vendor is changing and if that's approved.
Thank you.
Can I make a motion that we accept the proposal?
Thank you, Gene.
Second.
No, I think it's just information.
This was more informational. Yeah, we talked about this.
Okay,
Yeah,
we don't need to approve it?
Yeah,
Okay.
it's just a switch out and stuff like that.
Okay.
The dollars are cheaper and so forth. We're staying with the existing vendor. So.
Okay, thank you for
Okay,
the
thank you.
information.
Yeah, this was just really more from a transparency perspective. Again, where we had that change come, I just wanted him to alert the board to that since the board had already approved the funds to do the project and so forth. So.
Gene, my time is short on the board, I realize, but for being such a skinflint, you're quick to spend money.
Well,
I love you.
He's quick to do a good job with the money, so.
Okay, that brings us to item number 7, the draft audited financial statement. And this doesn't require action, but for information. And this was an item that was not in the agenda packet, but a separate attachment that was distributed at the same time. So Chet, we have you listed as the point. Are you going to tell us about this audit?
Quickly.
I'm going to tell you about the audit, but I'm going to tell you very briefly. As you know, we normally get the auditor's presentation to the full board with the final audit report. It's draft at the top of each page, I think. And there's if you looked at it otherwise, there'd also say draft. So consequently, in this particular year, Gary and the refinancing group needed or wanted at least a minimum of a draft audit prior to the resolution proposals that they brought up tonight and prior to the underwriter offering that will go out now that the board has approved this. So the other thing that happens is the timing, okay? You have to file your Medicare cost report even if you ask for an extension, by 120 days or so, by the end of November of each year, okay? Now, being a critical access hospital and having cost-based reimbursement, the auditors like to wait for the cost report, those cost reports to be filed before they actually issue their final report. Now, they may have done their report ahead of time and put some accruals in there for those. All that really relates to is the deductions from revenue and how each one handles that. And we don't use the same firm. Some providers do. I don't like to do that. I believe there's a specialist on one side, specialist on the other side, and then I like to see them audit each other's numbers. Well, the cost reports did get filed. They had a copy of the draft audit. They didn't have a copy of the final audit because it's like, what comes first, the chicken or the egg? So those had to be filed, okay? And what you do with that is you file them. They got filed on and signed and filed on the 30th of November. So we met the deadline with a proviso that should something material come in from the audit after that, we would file an amended cost report so that we could clear that up. But we met the deadline initially, and there was no real big disagreement with the audit, with the draft audit. Additionally, I actually sent a copy of the cost report that was filed to the auditors so they could use that as a basis for deciding their final numbers. And what I didn't want to do is introduce yet to the board for action the final audit. But Gary still had to have his. So let's just talk about real briefly, and unless the board doesn't want to talk at all about it or doesn't want Rick Jackson, who's the senior auditor over our audit, to come to actually speak on it next week when a final report, then
let me throw something out, Chad, just in the interest of time. I think certainly the board would want maybe to hear from Rick in a Zoom session or whatever. I don't think he needs to travel here unless you guys think that's important. But like I said, just like go over what the key points are from the findings on here and just summary real quick.
Yeah.
I think what they're after.
That sounds good.
Yeah.
So go ahead.
Just summary, real quick summary.
Just key findings.
Now that'll include the new board members if we do it next week?
Yes.
Okay.
I missed something. I got to kind of cut out.
All I wanted you to do is just give a quick summary of what the findings show. That's all. No detail. Because we're going to have, the plan is to have Rick come back. The plan is to have Rick come back and do a presentation next week when it's done. So
Yes.
just to highlight, that's it.
Yeah, that's my plan anyway, yes. Okay, the first part of the audit are the management discussion and analysis, and that comes from administration. Effectively, that comes from me and other comments from administration. And all we're trying to do is to take what they believe are audited figures and tell you what happened. It's like a variance analysis that you saw from me on the month. This is a variance analysis, if you will, a management discussion and analysis for the year. I just wanted to explain that. You go to the next section, okay? The next section actually are the auditors' report of the independent auditors themselves, okay? And it's pretty much verbiage about responsibilities, et cetera. There's only one part that I want to say anything about on this, and it's the opinion, which is the next item paragraph before the last paragraph of the auditor's report. And it says, in our opinion, the financial statements referred to above present fairly, in all material respects, the financial position of the district at June 30th, 2020 and 2019, and the results of its operations and its cash flows for the years then ended, in conformity with accounting principles generally accepted in the United States of America. So what you shoot for is an unqualified opinion. That's what we got, okay? Yeah. So what they're saying, and Gregory can explain it more if you need it, but you can get various other types of qualified opinion, disclaimer, going concern. All those are different titles that they can have for the audits that they do. So they say it's unqualified, and everything they found was up to snuff and correct. Okay, let's go from there. On the assets, what happened on the assets, and this is mostly on cash. Again, I'm only going to touch one or two things here. Our cash and cash equivalents went from 8.3 million to 15.6 million. Remember I talked about the money that came in and went in reserves, et cetera. We just had a great year with cash. And that's why we could put $4 million more away, mostly from supplemental, meaning a lot HHS from COVID-19, Prime from the quality side, and IGT from the Medi-Cal makeup side. Okay. Other than that, you could get to the net position. Okay. Net position of invested in capital, there's three parts. They're invested in capital assets, which would be what did you put in your equipment or hospital or whatever. And we have, since we did the 1991 retrofit, upgrade, new building, whatever you want, we had been in a negative position because the cost of that was greater than the value. So we were still at for the capital assets, we were still at a $4.4 million credit. We're now at a $2.4 million credit, and the unrestricted went from 4.9 million to 5.7 million, which is the total net position for the year, which means profit, okay? It even turned out a little better than I thought. $4,149,086. That is the profit on an audited basis for 2020. Okay? I don't expect that to change dramatically. And certainly, I don't expect it to go anywhere under 500,000 less. I really think it's going to be pretty close to that. Now, operating revenues are about the same. See, that's the next page. 30 million, 30 million, 30 million, 30 million 9, 1, 30 million 9. Mostly, effectively, the price increase of 7%. So if you go down, that's all the business about net position. Cash flows, I really kind of explained that. In now the operating income, we really didn't do that much better. I'm down now on the reconciliation. Cash operating income, 2.6 million in 19, 2.9 million in 20. I'm going to let, unless you want me to answer something or questions, I'm going to let Rick take it from there next month when he comes in with the final numbers.
Thank you, Chet.
So the bottom line was it was an increase in our net position of almost $3 million. Bottom line.
Chad,
Thank you.
all the years I've been on the board, I have never seen total assets increased in over $10 million
right
to the bottom line from the prior year. all the years. And I think that's the most wonderful thing I have ever seen. Thank you. Thank you. Thank you.
You're welcome.
Getting better.
Any other comments or discussion?
Oh, looks great.
I think this is great news. I'm ready to open a bottle of champagne. I just can't understand.
I am too.
I don't understand why all the monthly reports are so negative. This is
That's right.
great.
That's right.
It all evens out.
You guys
Okay.
have done a good job.
Thank you.
What's also important, I think, and Rick will verify this, that we have, after the audit numbers are in, we will have met all of our bond covenants. Met or
Wow.
exceeded all of our bond covenants.
That's great. That is great. Okay. That takes us to item 8 on the agenda. We've added 9 and 10, so this is not the last item. The swearing in of new board members. We have our,
We gotta take them in order because we didn't change the agendas.
what was that, Tim?
I said we gotta take them in order. I said otherwise we could switch it and do the other stuff first and do the swearing in last, but since we've already modified and approved the agenda, we can't, so.
I know.
So if you don't mind, I spoke with the elections office this morning, and I don't know if Fred and Catherine have been in touch with them or not, or have received any information, but since the election was certified only yesterday, the written oath statements that you will sign and return to the county will not be mailed out until tomorrow or Friday. So, and those will go to Heidi at the district office. So she'll call you when she gets them sometime next week, and then you'll come down and sign those, and those will be returned to the county. Because that really is the official oath and the one that the county is concerned with. You know, we're subject to their timetable. However, you legally take office at noon on Friday. And so what we decided to do was, since you will not have a written oath before then, you know, do the verbal oath tonight at the meeting. So you will officially have done all the steps that you need to do for your assuming office to be official. So that's why we're doing it this way. Usually this is ceremonial because you will have already signed the written oath and it will have gone back to the county. But tonight it's going to be a little more official since we don't have those yet.
Thanks, Scott. Do Fred or Catherine, do either of you have any questions?
Change your heart.
I don't have. I don't either.
Catherine, you went away.
I know. I wonder why that is.
I don't know, but if you haven't run out the door by now, you're in.
I had to fix my hair.
Oh, okay. Now, does this verbal swearing in, Scott, does this include Ross and John as well?
Yes, though they have different written forms that, no, actually they were elected.
Okay.
So they will sign the same form and they should take the oath as well. If there's no election because no one signs up to run against any incumbents, then it's a different deal. But everyone ran this time, everyone was elected. So yes, they should all take the oath.
Okay.
So does he need to read this individually for each person? Is that?
No, I think we can do it together. And everybody, the only thing that you have to remember is repeating what I say and remembering your name. And I think we can all do that. And if anybody's, when I say I and I say state your name, if anybody says state your name, I will find you and slap you.
You automatically lose office when you do that.
Yes, you do. I think that's the law. You're absolutely right, Scott. I think it's a legal precedent. Anyway, so for Ross and John, who congratulations on your staying on the board. I am very, very happy for you. For Catherine and for Fred, I couldn't be more proud to have you two coming on the board. Although I will not be an active participant at meetings and on committees, I will at all times be observing and participating and have a deep commitment to the healthcare district and all it has taught me, and it's a huge, it's a very huge and passionate thing in my life. So I will continue to follow it, and I know you'll do very well. I think we have some great candidates on board. So if you will, Catherine, Ross, Fred, John, if you'll raise your right hand, repeat after me. I, and state your name.
He said aye.
Do solemnly swear that I will support and defend the Constitution of the United States.
Do solemnly swear that I will defend the
Constitution of the United States
and the state of California against all enemies, foreign and domestic.
and the state of California
against all enemies, foreign and domestic.
That I will bear true faith and allegiance to the Constitution of the United States and Constitution of the state of California.
Yes.
That I will bear true allegiance to the Constitution of the United States and the state of California.
That I take this obligation freely without any mental reservation.
I take this obligation freely without any mental reservation
or purpose of evasion. And that I will well and faithfully discharge the duties upon which I am about to enter.
That I will well and faithfully discharge
the duties upon which I'm about to enter.
Adama. Congratulations. Yeah, as Scott said, your the elections office a little behind, and considering the circumstance, I think you're doing quite well. But you'll get your official papers to file. And welcome to the Board of Directors of the Kern Valley Healthcare District. I applaud you. You're either committed or should be.
Fine job, Charlie. Thank you.
You're very
Charlie.
My pleasure.
Okay, item 9. This is the agreement with the County of Kern for coronavirus relief funds.
Yeah, and this was again a late send out to the board, obviously primarily because we just literally got it yesterday from the county. They're asking that this has to be approved by the board prior to December 9th. And again, what this is the county is using some of their excess funds from the Department of Treasury to go back and reimburse special districts for what they're calling project-related costs. Obviously, the project being COVID and so forth. And they talk about eligible CRF program components for things like PPE, telecommuting, sanitizing, public health order enforcement, and this would obviously take into place anything we have to do for all this additional testing of our employees because of COVID. All of those expenses would be eligible payroll expenses, and there's others. And so, Scott, obviously you're much more familiar with this. You've dealt with this before. Is there anything you want to add? The bottom line, like I said, is we have to get this approved tonight. And then this would have to go, and I believe this is 4 out of 5 vote. Is that correct? I thought there was something unique about it. No? Anyway, what would then happen is we would go back and compile and file an invoice or reimbursement form with the county. If it is deemed that there are eligible expenses that we want them to cover, they would then issue a check to the district for that out of these funds. Okay. As with some of our other federal monies that this would also be subject to the audit, the independent audit that we have to pay for as to how those funds are being used and so forth. But it is considered a grant to the district or to any of the special districts that receive that. So Again, we submit that invoice or that list of expenses. The County Board of Supervisors would then approve those or disapprove those. And then we would, obviously, whatever is approved, we would get back.
Scott, you've looked at that, right?
I have. This is the contract the county is sending out to all special districts and cities. So once again, the county has managed to take a 2-page contract and turn it into a 20-page contract.
Figures.
When we signed the contract with the county for the testing, it's the same form, essentially. They've just changed the first couple of paragraphs. 90% of this contract is irrelevant, but dealing with the county, they have their standard forms, and if you want to change them, it has to go to the Board of Supervisors, and they just want to give you money. So this is a good thing.
We need
even though
it
it's a crazy
signed.
contract.
Can I make a motion that we approve it?
Thank you, Dean.
We don't have much choice.
I'll second.
John, thank you.
They're giving you money, so it's fine.
Right, great.
Good on the lose.
Is there any member of the public that wants to be heard on this contract, in this matter? Okay, any other questions or comments from directors? Okay, then Charlie, your vote.
Yes.
Barbara,
Yes.
Jean,
Yes.
John,
Yes.
and I'm a yes. Sign the contract.
Great, thank you.
Okay, and then the last item on our agenda before comments is item 10, 2 additional staff to aid in COVID testing.
As I think I shared earlier,
Yeah,
the
you
need.
know, do we need a motion for that?
Yeah.
Okay, I'll make a motion because we definitely need that. We're gonna get reimbursed, so.
Yes.
I mean,
I'll stop and I'll second.
man, I did too many today.
Getting a reputation now.
Just can't stop yourself.
We have a motion and a second. Does anybody want to be heard on this matter? Any other questions or comments? Okay, I think it's a smart move, Tim. I appreciate you doing this.
All right, thank you.
Charlie, your vote.
Yes.
Barbara,
Yes.
Jean,
Yes.
John,
Yes.
and I'm a yes. Okay, thank you all. Now, that brings us to item H, which is the director's comments on items not appearing on this agenda. And John, we'll start with you.
Okay, well, once again, just wanted to formally welcome Fred, Catherine, and Ross coming back on board. Looking forward to working with y'all in the coming next couple of years. Want to thank both Charlie and Barbara for their years of service on the board and for all your contributions since I've been on board the last 3.5, almost 4 years now. Just want to also thank the administration and Tim with everything going on with COVID. I know it's really overwhelming, but you guys are doing a fantastic job, and I just
it's unique.
Yeah, just hope we get through all this and hopefully things get back to normal someday.
Not sure what that looks like anymore.
Yeah. And also, you know, I'm really happy to hear Chet's report about the audit. That looks really promising news. I know Chet has mentioned that for over a year now, that the net value of the district is finally, for the first time in 30 years, is looking really good. So I'm really excited to hear about that. And finally, just Merry Christmas to everybody. So
likewise, thank you.
Thanks, John. Director Parks?
Charlie and Barbara, it's been a real honor. You guys, you're so good. And thank you for spending your time and helping me to learn a little bit about what's going on. And Charlie's smarter than he looks like he is. And I'm looking forward to working with Fred and Catherine. They're both very sharp, very good people. So it's going to be awesome next year. Next 4 years for them, 2 years for me.
Thank you, Gene. Director Casas.
I just want to say welcome to our new board members. And Catherine, I had something to give you tonight. It was a mask to go on to your camera at home. Well, one afternoon you were looking at a committee and you forgot your camera was on. And you went to get into something more comfortable. So I brought it along to give to you so that I could have a good joke with you. Anyway, I thought you were going to be here tonight. I'm sorry. Anyway, you guys are inheriting. I didn't want to get weepy. A wonderful crew was proved tonight by that financial report. I've seen the days when we thought $2 million was a lot of money. And this talented crew here at this hospital has taken this healthcare district and made it like it's in competition with the big guys, with the big hotels. I call them hotels, hospitals, and that have tons of money and live in an area where there's tons of people. These people are scrappers here. They're not going to let anybody put them down. And I think all the two new board members are scrappers themselves, and I think they'll fit right in. I admonish the remaining board members to be sure and keep in touch with each other and remain aboard. Don't get to the point to where you're not in connection with each other. You're supposed to be a joint board, even though you're autonomous as one member when you are voted in by the population here. Don't ever forget that, who voted you in, because that population can stand between what is good for this community and what is bad. And your reputations are on the line. Anytime that you're out there in the public, you make a good impression and you answer the questions if you can when they ask you, that's for sure. Be a good board member and take care of each other. That's it, the important thing. Stay together. Don't fight among yourselves, because that's unworthy of the employees of this district and the ones that fight so hard to keep this healthcare district clean and good and worthy in this area. That's all I had to say.
Barbara, thank you. Gonna miss you.
Thank you, Barbara.
You stay in touch too.
Okay, Director Bush.
I will be watching you all. No, first of all, I want to say, Fred, I may have to hand the mantle of keeping a sense of humor about things over to you and Ross to kind of split up. I want to say in my time in doing this, I have come to very much. I'm very thankful for the friendships and the education that I've gotten, and my respect and admiration for the administrative staff and all the employees of the Kern Valley Healthcare District. Catherine, I know with your personal history and your family's history with the district, you bring a very special set of awareness to the situation, not only for yourself, but for the hospital and for the community. And I know you will follow that and it will serve us all very well. Fred, you remind me of me when I was a kid. You came into town, you hit the ground running, as I did when I came here, because I thought, there's no better way to affect change and direction than by getting involved. And you've never shied away from that. And you have my utmost respect for that. for all that you do in this community. Both of you have done so well. Ross, I'm so happy you're staying on. You were a find. You were a nugget in there. John, you're great. It's just been a great board to work with, and I appreciate it. Mark and Tim and Chet and all of you, and everybody that works under you. Barbara, I love you. You taught me a lot. We had a lot of good times together. And don't discount the possibility that I may be back at one point or another. I think I have 2 years to consider that. So, but I want to congratulate all of you and say what a pleasure it's been to serve this community. And I wish you all the best.
Thank you, Charlie.
Thanks so much, Charlie. Okay, I do have a couple of comments myself. Yeah, I got to get a little bit of business. Committee assignments, since our new board members will be sitting on the committees for December, our December meetings. Catherine, you're going to be on the compliance committee. As we talked on the phone, I'm not sure compliance, it meets quarterly. I'm not sure it's a meeting in December, but if there is a meeting, you're it.
Okay, I'll be there.
Then the Personnel and Policy Committee, Fred and Catherine both are assigned to that committee. Catherine will chair that committee. And the Building and Planning Committee, all the board members sit on that committee, so you two are both assigned to that committee as well. I also want to thank Tim and the management team and all the people who stepped up to do the testing, the 2-day testing per week. This was a need that the community called for, and the hospital stepped up and is providing this to meet the community's needs, and it needs recognition. I didn't want the day to go by without recognizing the effort it took to pull that off in a very short period of time, in a matter of a day or two. And it was the right thing to do, and it was something the community needed, and thanks for putting that together and making that happen.
My pleasure. Because that was the staff that did the work, and they worked. So again, I will pass on your comments to them.
Thank you. Thank you so much. And Barbara, you've had nearly almost 30 years on this board. You're an institution, and you have such grace. It's been such a pleasure to work with you. And I know our board won't be the same. I know that our 2 new board members bring their own gifts to the board. But I'm really going to miss working with you, and you've been such a pleasure to work with. And thank you so much for the knowledge and the perspective that you brought to this board. And Charlie, I don't know if Fred and I can come anywhere close to the humor that you bring, along with your wit. I mean, your wit and the wisdom that you bring. Such a solid perspective, always bringing us back to reality. So thank you so much.
Thank you
for your support for me, getting me on this board in the first place, and then very much appreciate that. And good luck to you. I hope you do make it back here one of these days.
Thank you.
And I know, you're not going anywhere. You're just an icon in this community, and I know you'll be there for the district. So thanks so much for your service.
Thinking about going into the insurance business.
Gene and Fred are really going to like that. And Fred and Catherine, welcome aboard. I haven't ever talked to Catherine before 3 days ago, and then we've talked on the phone every day since. So getting to know you, and I think you're going to be wonderful to work with. I already know Fred's going to be wonderful to work with. So welcome aboard, and let's continue to make things make good things happen for the district.
Thank you. Glad to be on the board.
Good deal. Me too. All right.
I do have a couple of things that I would like to add, Ross, if I might.
Please do, Tim.
Again, I want to thank everyone for all their help. I mean, this is the counsel that I received from the board and input is always appreciated. I look absolutely forward to working with both Catherine and Fred. And again, anytime you have questions or whatever, you need to meet with me, call me, talk to me, whatever, I'm always there. And I think the rest can share with you that I do that. Again, I want to personally give my thanks and appreciation to Barbara. We've had many conversations over the years here. And I've always appreciated her insight on things and perspective. And so I will miss that. And, again, I wish you the best going forward. And Charlie, we've been through a lot, obviously, just with, our time together with some of the community organizations that we've been involved with and getting the River Rhythms program going and that whole thing. It's just, it's been a delight. And I continue to look forward to working with you in whatever capacity that comes down for the betterment of the district as well. I do, again, want to wish everybody happy holidays and so forth. I do have a presentation that I would certainly like to make. And Fred, Charlie, you're not here, but I will certainly deliver yours personally. But this is, we've gotten for Barbara. And it's just share that with everyone.
Oh, well, thank you.
It says Barbara Ann Cassis, an appreciation of your contributions and dedication to the healthcare district board of directors from 1992 to 2020. So I will
Wow.
present that to you.
Quite a legacy, Barbara.
Thank you so much.
Thank you.
Thank you.
Quite a legacy.
Charlie, I will deliver yours personally. Maybe we'll do it over a beer or something like that. So
I look forward to it. Yeah.
That's beautiful. Thank you.
you are welcome.
And this one says Charlie Bush, short timer. On it.
Here it.
Thank you, Tim. Is there anything else?
That's all I've got.
All right.
Okay, gang. Have a wonderful holiday, and we will see you at the committee meetings in January. And as a whole board, building and planning, and then our first meeting in January. We'll reorganize once again. So thank you. We stand adjourned.
Thank you.
Thank you. Have a good evening.
Thank you.
Good night, everyone.
Good night. Thanks, Scott. Thank you, Carrie, everybody.
This is a.
Hey, Tim.
Yes.
Thank you. Good night.
Don't forget to hit that record button.
Yes.
You hold him down.
Yeah, Heidi left me instructions.
Okay.
So,
Good stuff.
no,
Chest down. How did you keep him from flying in the air all the time? I mean, something that.
I need to leave. What I need to do is go ahead and exit out.
Excitement was.
All right, take care, all.
Bye-bye.
Bye, Ross.
Bye, John.
Been nearer than he's been virtual. 1 year.